the coffee is important.
Oh yes, extremely important. Definitely, without a doubt. Okay, we shall start now. Faisal, if you're ready.
Thank you. So, good evening, good afternoon, and good morning to everyone who are joining us today from all over the world. A very warm welcome to our session 12 of the Global Advanced Certification Program on Strategic Research Collaboration and Communication for Emerging Researchers and the International Workshop Series, proudly organized by the Global Consortium of Global Health Actors, Leaders, and Thinkers, the Global Health Forum, World AIDS Forum, the Global Brain and Mental Health Forum, in collaboration with local delivery partners, Bangladesh Institute of Innovative Health Research. Today marks session 12 of our international workshop series and panel discussion series, which features eminent speakers from around the world each weekend. So far, we have had a group of preeminent and world-renowned speakers from top academic institutions and top global organizations in Africa, Asia, and the Pacific, Australia, India, Malaysia, Singapore, the UK, and the USA. Today, we will embark upon a new journey: environment, climate change, sustainability, technologies, and public health equity, reframing SDG attainment, featuring two focused sessions comprising distinguished lectures and panel discussions. We gather leading minds from Africa, India and Africa to reflect on the present and future of health systems, equity, leadership, and the collective pursuit of the SDG Agenda 2030. These discussions aim to unpack the real world challenges and showcase the pathways toward transformation. Our engagement with planetary health is a part of our long standing vision: One World, Our World, and Global South led development. And this Global Health and Development Dialogue series is a symbolic manifestation of our strong commitment. Once again, we are joined by our respected moderator and host, Professor Maheshwar Satpathy, CEO and founder of Global Alt and director at COE ECC who will guide us through these impactful discussions. The lead organizer of this program, the Global Consortium of Global Health Actors, Leaders, and Thinkers, operates under the Global Health Leadership by Global South Initiative, a flagship program of the Global Health Forum since January 2025. The Global Consortium brings together global health experts, researchers, practitioners, and policymakers, especially from developing and underrepresented regions, to collaborate on transformative research that drives equity and systemic change in health. As of today, the Global Consortium is the largest dedicated professional consortium of global health, with more than 2,700 leaders from 170 plus countries who have applied to be members through a rigorous process of member selection and full documentation of members' credentials. In addition, 260 plus small and large organizations of value and civil society organizations have applied to be our member collaborating centers of excellence in the Global South. Our vision is reimagining global health leadership by the Global South, decolonizing global health. We are the global alternative. The Global Health Forum, elevating voices, reimagining global health, uh, building equitable futures for all since 2018. The Global Health Forum is a dynamic international platform committed to transforming global health through inclusive dialogue, critical research, and ethical collaboration. As the parent institution contributing to the Global Consortium of Global Health (GHOLD), GHF serves as a bridge between academia, policy, practice, and communities, especially those from low and middle income countries and underrepresented regions. GHF envisions a future when global health is decolonized, democratic, and driven by the lived experiences of those at the margins. We create a space for cross-disciplinary exchange and nurture the next generation of global health leaders through strategic training programs, public health forums, and capacity building initiatives that cut across the geographic borders, cultural and social milieu, and disciplinary boundaries. World AIDS Forum. Since 2011, a high-level global forum to network and collaborate with all stakeholders and communities on infectious disease, HIV and AIDS, ABVs and STIs, with the aim to unite the world to inform, debate, and discuss and act. instrumental in conducting several hundred programs, interventions, program delivery, and implementation and knowledge dissemination, and intensive community outreach by leading and collaborating with program partners from all over the world. The Global Brain and Mental Health Forum, reimagining mental health leadership for a resilient and equitable world. Since 2020, GBMHF is a collaborative interdisciplinary platform dedicated to advancing brain health and mental well-being through research, policy advocacy, and international knowledge exchange. Founded as part of the broader vision of the Global Health Forum and to complement the mission and objectives of Global Alt, GBMHF aims to unite researchers, practitioners, policymakers, and people with mental health issues, as well as the lived experiences, advocates across the globe, particularly from the Global South. We focus on building capacity in neuropsychiatric research, destigmatizing mental illness, and promoting culturally competent mental health systems that are equitable, accessible, and sustainable for all. Through academic programs, high-level dialogues, and grassroots initiatives, the forum champions a holistic, intersectional, and inclusive approach to mental health. Bangladesh Institute of Innovative Health Research is a non-profit research organization led by the volunteers. It works to encourage research among young novice researchers since 2023. BHR has been active in research and has regularly organized training sessions, workshops, and seminars to build research skills. The team include around 40 student research assistants and more than 10 members in core managerial roles. PHR is committed to supporting the next generation of researchers and helping improve public health in Bangladesh. Some ground rules for our session participants: please be muted during the session and unless you are invited to speak. Use the chat box and Q&A for any kind of reflections or questions arise during the session. Attendance will be tracked from start to end, and an additional attendance form will be shared during the session. So you have to fill the form to be eligible for your certification. Maintain a respectful and inclusive environment throughout. Chat box will be monitored regularly. Any unnecessary, repetitive, disrespectful, unprofessional, and hateful comment in the chat box or Q&A targeted towards anyone will be deleted, and such persons will be removed from the session. So our first panel discussion today is AI in SDGs attainment, futuristic computing for the future of humanity. We are honored to welcome an esteemed panelist today, Professor Praveen Kumar Shukla, Professor of Computer Science and Dean of Engineering, Babu Banarasi Das University, Lucknow, UP, India. Hosted and moderated by Professors Maheshwar Satpathy, who is a world-renowned leader in One Health, global health, planetary health, and brain and mental health. He is a much sought after all expert in epidemiology, health emergencies, and implementation science and health innovation using the power of emerging and futuristic technologies such as AI, ML, LLM, and generative AI, and geospatial information system science and technologies and remote sensing. He builds on his core areas of expertise in cognitive psychology, cognitive and computational neuroscience, psychology, and global health to benefit humanity. His sustained engagement with UN Sustainable Development Goals and ethics in broader area of the public policy has led to holistic societal transformations in various LMICs. Professor Satpathy has a humble H index of 81 and cumulative citations over 160,000 plus. He has published extensively 285 plus peer-reviewed scientific articles and book chapters in journals of global repute, notably in Nature, Science, The Lancet, NEJM, JAMA, BMJ, PLOS, Frontiers, and etc. And also has offered keynotes and invited talks at more than 200 top international conferences and global congresses in the past 20 years. He has an impressive volumetric score of 68,255, exemplifying the large-scale social impact driven by their work. Professor Satpathy is currently a research fellow, research professor at the Institute for Global Health and UCL Global Business School for Health of University College London, UK, and is also a substantive faculty member, professor at Utkal University, Bhubaneswar, India. He is the director and lead of the Center of Excellence in Environment, Climate Change, and Public Health and Policy, a joint initiative of the Government of India and Odisha since 2023. He has a successful track record of over 20 years in designing, delivering, and evaluating global and national public health forums. His multifaceted engagements in Asia Pacific, Africa, and Europe, and clinical practice in India have contributed to his well grounded perspective and expertise. His strong diplomatic skills and a proven track record in developing strategic partnerships have helped from vital global collaborations, enriching public health and mental health policies and initiatives. His multidisciplinary approach, integrating development policy with global health, has empowered teams to translate complex research into societal impact in LMICs. So we now invite Professor Satpathy to introduce our panelist, Professor Praveen Kumar Shukla, and guide us through this important discussion. Thank you.
Okay. Okay, thank you, Faisal, for the wonderful, generous introduction. So it is my utmost pleasure and honor to welcome both Professor Praveen Kumar Sukla and Dr. Martha Chadiwa on this virtual stage of Global Consortium of Global Health. So it's a pleasure. So it is my honor to welcome and also introduce Professor Praveen Kumar Sukla. Professor Praveen Kumar Sukla is currently serving as a professor and dean at the School of Engineering, Babu Banarasi Das University, Lucknow, Uttar Pradesh, India. He is also an adjunct faculty at the SAU Center for Research and Innovative Learning, SCRIL, South Asian University, New Delhi. Dr. Sukla is also the Executive Committee member and Secretary IEEE CIS UP chapter. Dr. Sukla holds a PhD in Computer Science and Engineering from Dr. APJ Abdul Kalam Technical University, Lucknow, Uttar Pradesh. He also holds MTech in Computer Science and Engineering and BTech in Information Technology from Uttar Pradesh. His research area includes fuzzy systems, interval type 2 fuzzy systems and type 2 fuzzy systems, machine learning, computer vision, and deep learning. He has published more than 60 research papers in reputed international journals. He has been honored as keynote speaker and session chair to national and international conferences, different faculty development programs, and workshops. He has a humble H-index of 13 and cumulative citations bordering 500. He worked as the General Chair of the International Conference on Computer Vision and Robotics, CVR 2021, CVR 2022, CVR 23-24, and WCSC 24, Conference Chair of the International Conference of Undergraduate Students, ICUS, and several other conferences of repute. In addition, he is also the founder-president of Artificial Intelligence Foundation Trust, Lucknow, India, which is one of the collaborators of today's sessions. So with this very humbling introduction, may I request Professor Praveen Kumar Sukla ji to kindly deliver his illuminating talk. We are very, very eager and enthusiastic about listening to your interesting talk. There are lots of participants who want to know more about artificial intelligence. So the stage is all yours. Thank you.
So good evening, everyone. And thank you, Professor Maheshwar, for such a nice introduction. And also all the audience, esteemed audience of this session, Professor Martha. So let me proceed with my session by sharing the screen. And as you know that I will be delivering the content on artificial intelligence applications in sustainable development goals with the help of futuristic computing. So this is really very important. I will try my best to deliver important statements, content, and information to all of you so that you may be aware with the artificial intelligence as well as different sustainable development goals and what is futuristic computing and what can we improve, how can we improve the future of the humanity with all these. First, I will have a brief on the lecture that we have for next 1.5 hours. That we are going to have introduction about sustainable development goals, all 17 SDGs, and then after we will go for artificial intelligence and we will try to understand that why it is too urgent for the application of AI in such kind of applications. Also, we will discuss about AI versus human thinking how can we simulate, or how are we simulating the human decision making capacity with the help of artificial intelligence in machines, and how artificial intelligence can be mapped with the sustainable development goals attainment. Apart from this, we will go for AI applications in healthcare sector, climate action, and then after we will discuss about AI applications in SDG financing. Apart from this, we will also discuss about data ethics, AI bias, digital divide, and different challenges and risks which are associated with the AI-driven implementation to achieve the sustainable development goals. We will also discuss about partnership and global governance, and what is the future aspect while using artificial intelligence in achieving these sustainable development goals. Apart from all these things, we will go for one experimental, very short experimental uh, discussion that I will discuss about a smart agriculture application in which a Python based program that is developed using deep learning models. And in that Python application, we can have the capacity, or we can have a AI supported capacity to identify a disease in potato vegetable trees, in the crop of potato vegetable. So that is an application which can be used in smart agriculture. So that is developed in Python programming language. So I will discuss it in programming, and I will see you. I will show you the simulation of the complete program at the end of this presentation, or in between mid we can take this. All right. So let's proceed with this presentation. That we know that what is technology? That is just a tool of convenience, and all these technologies like artificial intelligence or near about technologies like internet of things, blockchain technology, and quantum computing, all these different technologies are playing a big role in the development of the society and the global changes also. So while implementing artificial intelligence, it is really very important to design it very ethically, that I will discuss in later also in AI bias. And we have one more important concern about AI implementation, that it must be responsibly deployed. And we have a responsible artificial intelligence. It's a different segment while implementing the artificial intelligence applications, that we must ensure that all the AI applications should be implemented very ethically and very responsibly, that they should not harm, or there should not be any drawback of the implementation of any AI product in the society or the services. As we know that we have 17 SDGs, and they are basically the roadmap to have a more equitable, inclusive, and sustainable future for all of us, like climate patterns, optimizing agriculture yields, to advancing healthcare access and improving education delivery. All these are the different outcomes, you can say, from these sustainable development goals. And we are going to apply, and we are applying artificial intelligence applications in all such kind of activities which are related to sustainable development goals. So the important thing is that before moving further, we have to take a overview of a 2030 agenda, which is for sustainable development, because it will create a base for this presentation, this session. And then after, we will go for each sustainable development goal. We will try to understand that what is the meaning of all these 17 sustainable development goals. And then after, gradually we will go for the implementation of AI introduction and the implementation of AI in SD. So, you know that on September 25, 2015, by 193 UN member states, uh, a universal call to end poverty, protect the planet, and ensure peace and prosperity for all by 2030. This was basically the discussion and agenda, 2030 agenda for the sustainable development. So, in this sustainable development agenda, uh, there were 17 Sustainable Development Goals, SDGs, that were established during this meeting. And there are 169 targets. These are very important statistics about this Agenda 2030 agenda, that we have 17 SDGs and 169 targets, 233 global indicators also. And it was with the principle of leave no one behind. And there are three core dimensions which were established for 2030 agenda. That there is a the first one is social development, which includes health, education, equality, and institutions. And there is one economic growth, that is related to jobs, infrastructure, innovation. And then after, the environmental protection, like climate action, biodiversity, and sustainable consumptions, etc. So these are the three core dimensions which were included while 2030 agenda. So this is about the 2030 agenda. And then after, because we are going to more focused on the 17 sustainable development goals, SDGs. So let us discuss about all these. Let us try to understand that what is the meaning of these 17 sustainable development goals. So I hope that you all are seeing on the screen all these 17 SDGs. SDG 1 is related to no poverty, and second development goal is related to zero hunger. Third one is good health and well-being. Fourth one is quality education. Fifth is gender equality, and you can have a description also for these sustainable development goals. And sixth one is clean water sanitation, and seventh is affordable and clean energy. Eighth is decent work and economic growth. Ninth is industry, innovation, and infrastructure. 10th is reduced inequalities. 11th is sustainable cities and communities. 12th is responsible consumption and production. 13th is climate action. 14th is life below water. And 15th is life on land. 16th is peace, justice, and strong institutions. And 17th is partnerships for the goals. So this slide is giving you an overview of all these 17 sustainable development goals. That what is the goal title? It is very well self-introductory. There is nothing, but still you can go for the descriptions of all these sustainable development goals to understand. And I feel that because I first time studied about all these 17 sustainable development goals at a time, because I was aware with this poverty in which we are zero hunger, in which we are having smart agriculture also, and a lot of other we I studied about these sustainable development goals. But at a time, all these 17 at the same screen, I also studied for the first time. But the thing is that I feel that all these 17 sustainable development goals are related to our directly related to our life. And if we focus, if our governments, our policy makers, and other persons will focus on all these 17 sustainable development goals for their completion, our life, our future will be very much secure, and our life will be good and good. Even we can say that it will be best in this globe. So let's move further after the introduction of all these 17 sustainable development goals. That now we will go for because it was proposed in 2015, and today we are in 2025. That means 10 years uh, was uh, was happened with the development of all these sustainable development goals. And we have 5 years remaining to complete the target. So let us see what is the progress highlights till now on each of these sustainable development goals. So let's discuss all these things. That the first sustainable development goal one, which is related to no poverty, it is on off track because extreme poverty rising post pandemic in many regions. 700 plus million people still live on less than $2.15 per day income. So lot of things, lot of problems with this sustainable development goal. Whatever we propose to do, that is not happening. We have to take care of all these things. And I will show you later that how can we apply artificial intelligence to deal with this no poverty, what artificial intelligence can help. Uh, I want to mention here that all these data or the facts that I am presenting here, that are taken from the United Nations website of Sustainable Development Goal, which is given in the last of this progress report. So you can refer to that for the detailed description of these progress highlights. Similarly, for zero hunger, 2.3 billion face moderate to severe food insecurity. A lot of urgent actions are required, like climate smart agriculture implementation, and improvement of the supply chain is also a very important concern, because many times due to the problems in supply chain, the grains are going to destroy, which can be used for the food of any person, but sometimes the supply chain will lead to a big problem. And after that, for Sustainable Development Goal 3, where we have good health and well being, it's a mixed progress. That child and maternal mortality is down. But after pandemic, after COVID, a lot of problems in the healthcare sector are now existing. Like at this time, we have to strengthen our primary healthcare system. Pandemic preparedness is also important because we have not planned for this COVID-19, and in future there may be any of the pandemic condition. So we have to plan accordingly, and our universal health coverage access, that is also to be implemented very properly. After that, for Sustainable Development Goal 4, quality education, 250 million children lack basic literacy and numeracy, 70% learning loss from the COVID. We shifted to online learning systems, but online learning system is not effective for each of the study or each of the training. For example, I'm from computer science and engineering background. I'm discussing here artificial intelligence, SDG, and I will discuss about some Python programming and artificial intelligence later. So you are very you will be feeling very easy to understand all these things. But what about civil engineering? But what about mechanical engineering? We cannot do uh, better in civil and mechanical engineering through online mode, because we have to go for the outside, we have to go to field, and then after we have to go for the real, not simulation, real experiments must be there for the civil and mechanical engineering, and even in electronics also. You cannot do all these things online. So a lot of problems are there. After pandemic, online shift is there, but for such kind of training, we cannot apply online learning everywhere. So this was about Sustainable Development 4, Goals 4, and after that we have SDG 5, that is related to gender equality. 26.5% of women hold approximately in parliamentary seats and worldwide. There are a lot of other data available in different segments, but we have to still take care of the gender-based violence and close pay gaps and empower women leaders. We have to take care of all these things. And it has a very slow progress in gender equality, is not doing very well. Clean water sanitation, it is significantly off track because 2.2 billion lakh safely managed drinking water. So we have to take care of improving water, sanitation, hygiene, infrastructure, and address water stress also. Because in many areas there is a big problem of water, and especially the drinking water. Because water is a very important concern for the society, because a lot of health problems are being created with this infected water. And I think many of you are from health sector, so you can understand very well that what is the role of clean water in our life, considering the health constraints. After that, in SDG 7, that is affordable and clean energy, it's a more in moderate progress, because now in India, I'm also seeing that we are having progress with the solar energy. Everyone is using solar energy, and even with the use of the solar energy, we are creating energy and we are sending it to grids. So that is also, even we are using, we have a consumption for our house appliances. We have the power for our houses, and apart from this, whatever the more power is being generated, that is being transferred to the the grids also, or the electricity stations also. So it is okay, affordable and clean energy. And now we come to Sustainable Development Goal 8, that is decent work and economic growth, it is recovering unevenly because there is a problem, and it is depending on the geographical locations also, the countries also. Many places, many countries, they don't have a plan for their youth employment, and a lot of problems in India also, because there are so many sectors where the education is not good. They don't have any they don't have actually sufficient digital infrastructure, and also there is a lack of money. Unemployment is there, so a lot of things are there. We have to take care of all these things, and to give a job uh, in India, there are a lot of activities are being done by the government, like Startup India. They are also supporting for MSME. Lot of funding and other support are available from the government of India, and at the state levels also funding available. So the youths can go for their employment and their business also. So a lot of things are going to happen in India, but if we go for a total development, then we can say that it is recovering very unevenly. So we have to take care of it at a local level also. Apart from this, in Sustainable Development Goal 9, industry, innovation, and infrastructure, it is mixed, because we know that internet penetration is greater than 95% in high income and less than 30% in low income. So there is a very uneven distribution here also. So we have to invest, means the government should take care, and the other persons, other societies, and other uh, social activists, they can go for the resilient infrastructure development, and innovation ecosystem should be developed for the society. And after that, we have reduced inequalities. That is, top 10% earn 52% of income. Migration and exclusion growing. This is also a problem. So, by implementing fair tax, inclusive social policies, and access to opportunity, these are the urgent actions which are required. Reduced inequality. SDG 10 is not also in a very good condition. In SDG 11, which is sustainable cities and communities, it is in off track, because 1 billion plus live in slums. Disaster risk increasing in the urban areas also. So a lot of things can be done here to get it on track, by proposing smart cities, improving transport systems, and as well as to have uh, a monitoring system. I think the sanitation and other uh, infrastructure of the old societies also must be taken care, because now this is the time of rain, and from the different cities I am seeing the news that there is a water logging, lot of water flood is in the society. So that should not happen. Once a society is established, there must be a mechanism of water flow, proper water flow from the society to outside. There must be a mechanism. So I think all the all the like we have here in Lucknow Development Authority, municipal corporations, etc., and Gram Panchayat, etc. They should take care of all these things. That where are the societies? They must be equipped with the infrastructure to deal with all such kind of waterlogging kind of problems. Apart from this, we have this SDG 12, that is responsible consumption and production. This is very slow. Global material consumption up 65% since 2000. So we have to promote circular economy, reduce food waste, enforce environmental, social, and governance. That is ESG standards. We have to enforce them also. After that, this SDG 13, that is the climate action, and it is severely off track because global CO2 emissions hit a record high in 2023. So the thing is that we have to take care of emissions, means CO2 emissions, and we have to take care of NDC ambition also. NDC means this nationally determined contributions, and adaptation financing must be scaled. So these are the few techniques that can be applied for the climate action. And now I think climate action is directly related to smart agriculture or agriculture activities, we can say. And agriculture activities are connected with this Sustainable Development Goal 2, that is zero hunger. So everything is connected with each other. So that's why we have to take care of this climate action also, because it is disturbing a lot of disturbance can be created for the agriculture activities by the climate disturbance. Life below water, it has a very weak progress. Only 8% of oceans are under protection. Marine plastic is still rising. So these are the things I am proposing here. Few of the urgent actions which can be taken, like expanding marine protected areas, enforce ocean treaties. Lot of things are there. So we can do all these things for life below water. And in SDG 15, that is life on land, it is regressing. Forest loss continues, and 1 million species at risk. Halt deforestation, restore degraded lands, strengthen biodiversity laws. These are the some urgent actions which are required for this Sustainable Development Goal 15 related to life on land. Peace, justice, and strong institutions. This is deteriorating in fragile states, and over 100 million displaced due to conflict, rule of law in decline in many regions. And I think in last 2 to 3 months, I'm seeing a lot of things, lot of bombs, and there are so many news at the international level. So there must be a mechanism that must be implemented also to deal with the to implement actually the peace and justice and strong institutions. So after that, last, this is Sustainable Development Goal 17, that is partnership for the goals. It is underperforming because dollar 4.2 trillion annual financial gap in the global south, and we have to take care of actions like reform global financial architecture, enhance data partnerships, and expand south-south cooperations also. So these are the 17 sustainable development goal and their progresses. What are what we are at this time, and these are the sources you can see here. Two websites address where you can study more about the progress of the sustainable development goals. All right, so now there is a UN SDG report 2023 plus SDSN 2025. It's a global snapshot actually. So here is some statistical data that the percentage SDG targets on track, uh, they are 15%. Moderate or severe deviation is on 50%, and percentage stagnated or regressed is 30% plus. And global SDG index score is on an average it is 66.7 by 100. Financial gap is dollar 4.2 trillion by year in the global south. And for this information, to check this information, you can go for these sources, these websites which are mentioned below. Uh, Actually, if we consider about the current status, and there are so many setbacks also. What happened while implementing and while making progress with all these sustainable development goals, and these are COVID-19 pandemic. This reversed decades of the progress in poverty, education, and healthcare. You know it very well. So climate crisis is also in parallel happening at the many places. Conflicts and inequality, a lot of violence and a lot of things are happening around the world. Data deficits, it is also very important because few of the sustainable development goals have very lack of data due to some reasons. So data deficits can be improved by this artificial intelligence. That I will tell you later. These are the setbacks that we can say that if we are not progressing with with the different sustainable development goals equally, means in some of them we are on the track, in some of them we are not progressing up to the mark. So what is the reason behind that? We can go for these setbacks. like COVID-19, climate crisis, conflicts and inequality, and data deficits. After that, if I go for the region-wise progress, so you see that in Europe, we have a leading in the SDG index in Finland, Sweden, and Denmark. They are leading in the SDG index. South Asia, they are mixed. Sub-Saharan Africa, Latin America, Pacific Islands, these all are performing as per the keynotes that are given over here. So this is the geographical reason wise progress data that you have for the sustainable development goals. What are the high risk goals? Actually, they are on off track globally. Number one, it is no poverty. Second one, zero hunger. Fourth is quality education. 13 is climate action. 14 is life below water. 15 is life on land, peace, justice, and institutions, and global partnerships. So all these SDGs are on high risk that we have to take care of all the activities, all the progress that we are going we are going to plan for these sustainable development goals, because they are off track globally. So we have to take care of all these sustainable development goals. Now, what can we what can we do for 2025 to 2030, because 5 years are remaining. So there are some suggestions mentioned over here, like finance reform, green and digital transitions. You can go for the details also here. Many things are mentioned. Data revolution, it is the implementation of AI, south south cooperation, and youth and gender equity. So these are the different aspects which can be prioritized as a global action to achieve the sustainable development goals in 25 to 2030. Now, this was all about what are the sustainable development goals. Basically, what is 2030 agenda, and then after we came to sustainable development goals, we introduced them, and then after, what is the exact position till now, and what can we do for the next 5 years? How can we plan? So you have seen till now that there is a lot of scope which is remaining to do in the progress for the completion for achieving all these sustainable development goals. And artificial intelligence can play a very big role, because data is important. Data is playing a big role in all the sustainable development goals. And we can say that, and you know it very well, now at this time, for example, you have a data, and manually, uh, before 10 years, when we were processing this data, 2 to 3 office clerks were working on this data, and then after, they were producing the results in 3 to 4 days, depending on the quantity of the data, or they may take 1 week also, or few of the data can be processed in months also, manually. But after that, computers came, Excel, Microsoft Excel, Microsoft Access. There are so many other softwares based on database systems like Oracle, MySQL, and lot of database technology came into existence, front end, back end development of the software for data processing, and data was processed. And after that, we were getting the data. But now, what is happening today? I was seeing one video that you can integrate Copilot with your Microsoft Office, with your Microsoft PPT, with your Microsoft Excel. So whatever you were doing with the help of the implementation of formula and coding into Excel, that artificial intelligence tool, that Copilot, will do it automatically by writing only a command, as you are writing in the chat box. So by applying these text-based instructions, you can do all these things, because to apply formula in an Excel or to write a code in Excel, that is not a that cannot be done by everyone. because there must be a big awareness of computer, then computer information and computer programming also. Then you can do this. But for a what about a common man? What about a person who is not aware with all these things? So in that case, artificial intelligence is there. Copilot you can integrate into that software, and you can easily process your data within minutes, which was possible for a day. So this is basically the benefit or advantage of application of artificial intelligence, that artificial intelligence is giving you the efficiency, means the work that you are doing with the help of a computer in 2 to 3 days, that you can do within minutes you can get the result by asking into your own language. You don't have to go for any programming language. I'm giving here you one another example, that uh, in last year, I think in 23 and 24, we were doing Python programming for some course and for implementation of different applications of artificial intelligence, like deep learning applications like convolutional neural network, recurrent neural network. So these are the different deep learning models. And in machine learning, we were implementing decision tree, random forest, and uh, support vector machine, k-means clustering, that is an unsupervised machine learning. So we were implementing all these things using Python. But now, a few days back, I came to know that in Python, if I write a command, that write a code for the implementation of support vector machine in Python, and it has written everything that you have. So I have taken that code and I am executing it in the Anaconda platform, and it is working well. The chat GPT is also suggesting you the data set, that you can download this data set from this URL. Otherwise, you have to go for the Kaggle or any other data source like UCI machine learning repository. You were going to search that particular data set, and then after you are searching for the data set in the indexes of all these repositories. But now, with the help of the chat GPT, you are going to that particular link and download the data set. So what happened? Your searching time, your searching time on these different repositories is reduced, and you can do it very well. So I don't require now a programmer or a coder. It is all done by machine learning, all done by the generative AI applications like DeepSeek or Chat GPT, etc. Everything is being done by that. So in this case, what can we do? There is a lot of work which is required for the implementation, for the success, for achieving the completion of these SDGs by the 2030. We have to apply AI everywhere where possible in all these 17 sustainable development goals. But the thing is that we have to develop the infrastructure accordingly. Otherwise, it is not possible, because whenever you are going for chat gpt kind of applications and implementations, you have to take care of the computational power. And the computational power is not like it is costly, because whenever you are going for purchasing the gpt, purchasing this gpu, which is very cost effective, computational effective computational power GPU. Uh, so that is costly. You can purchase it from NVIDIA and other companies also, but it is costly. So you have to develop the digital infrastructure accordingly, the computational power to implement all these things. So coming back to this urgency of AI that I am discussing, that lot of things are happening. Means lot of things are not being done in case of the sustainable development. So we have to take care the app we have to take care of applying this artificial intelligence. And the ultimately the objective is to have a fastest route to scale innovation, optimize resources, and address deep rooted development gaps, because AI can help you a lot to do the things in a very fastest way that I was explaining you since last 5 minutes. So these are the global crisis demands smart solutions like poverty and hunger, poverty and hunger, what can you do? You can go for the AI powered crop prediction, precision agriculture, micro edit scoring, early diagnostics, health informatics, telemedicine. These are in healthcare sector. Climate crisis, you can go for energy optimization, disaster forecasting. All these things, whatever I have written in this AI application, they all will be implemented with the help of artificial intelligence. In artificial intelligence means they may be a narrow artificial intelligence, they may be a general artificial intelligence, or they may be a super intelligent artificial intelligence application. So a lot of things, these things must be implemented with the help of AI to attain the SDGs, which are far behind till now, to complete it by 2030. Okay, so these are some urgent priorities: that AI for good investments, AI capacity building in the global south, ethical, inclusive, and transparent AI frameworks. This is really very important because now you can see that uh, I just want to here give you one case study kind of thing that is really very important for all of you, because when we are moving towards the applications of the computers, applications of the artificial intelligence, which is the next generation applications of the computer society, you can say, the security is very important. Last 15 days back, my LinkedIn account was hacked by someone, and all the information, the posts from last 5 years were erased by that person, and a lot of other information was also changed, but that was recovered. Except these posts, everything was recovered with the help of the LinkedIn. I'm really thankful to LinkedIn support center. But what happened? I lost all my posts because I was not having the backup of all those posts. So that was lost completely. What was the problem? Because sometimes what happens, we are not taking care of all these things. In LinkedIn, I was also not aware that there is some two-way authentication, but I had not done that two-way authentication in my account. That's why it happened. So I am a computer person. I am working in artificial intelligence. I am doing a lot of things in, I am doing a lot of programs in Python and everything. I am in the sea of the computer science and artificial intelligence, but I was not, I had not done this task to complete a two-way authentication in the LinkedIn account. And what happened? It was a very it was a setback for me that I cannot explain to you because it was a big loss. Lot of things, lot of posts, and lot of information that is not available right now because I am not also remembering that one. But I am still trying to have some getting these information from my backup files, but that will not be possible. So the thing is that this point, ethical, inclusive, and transparent AI frameworks must be developed, and awareness is really very important. And see, everyone has a smartphone. In this smartphone, lot of AI applications are flooding, and these smartphones are available with the person who is not knowing anything about this smartphone, because they are from rural background. They know that this button, if you click on the YouTube, it will play a video. If you go on Instagram, it will play a reel, and lot of applications they know. If there is a if there is a message that to download this application, and it will give you 2000 rupees per month after investing 50 rupees. So there are so many persons who can do, who can install all these applications with the help of this link. So my suggestion is that whenever we are going for the sustainable development, we have to make a plan, we have to make a policy for the digital awareness, I think, before implementation. Otherwise, what will happen? You are seeing in the society that societies are flooded with the water right now because we had not planned before the establishment of the society. We had not planned for the for the for this water treatment, and we had not planned for the basic requirements of the society. Otherwise, Again, it will happen in digital implementation in this sustainable development also. If we are not going to make a plan, if we are not going to make a policy, and it must be implemented from the government also, and it is social responsibility also, not from the government. Government will implement, but it is the social responsibility, and all the organizations which are related to trust, like societies, other societies and persons who are serving for the society, they must understand that we have to make awareness about this digital implementation or the AI implementation. It is an upcoming implementation. So I can say that this AI implementation, we have to go for a very deep awareness towards the society before the implementation of the AI applications. This is my suggestion. Now, the fourth point is AI-powered SDG tracking and impact modeling and public-private academic partnerships for responsible AI. That was I was suggesting here. These are some points which are the urgent priorities required before implementation or in parallel with the implementation of the artificial intelligence for sustainable development. Now, uh, actually, if we consider the classification of artificial intelligence, we have narrow AI, we have this general AI, and then after it's a super intelligent artificial intelligence. So now you see that you have a chat box on your website, on the website of a university, and it will assist you to take admission. That if you open the website, and it will the chatbot will be popped, and it will ask that how can I help you. So and it is available in different banking websites also. So this is an application that has that is in the category of this narrow AI, and these are basically the uh, is more is specific problem is specific, or you can say their scope is very limited. For example, one AI application is working for the medical diagnosis, one AI application is working for the speech recognition, or the chatbot that I just given an example. So recommendation systems are also there. If you are seeing videos or songs on YouTube, and on reels also, you can see in the Facebook and Instagram and all other social media applications, what kind of songs or reels you see, that kind of videos and reels will be presented to you by some AI application which is not visible to you, but you can imagine that what I want to say, what is my interest, that is being displayed, that is being delivered, because there are millions of reels and videos. So that will be delivered to you with the help of some recommender system which is not visible to you, but it is working in the background. So these are applications which comes into this narrow artificial intelligence. And after that, we have general AI, really very important nowadays, generative AI, basically. And chat GPT, chat GPT means generative pre-trained transformer. Chat GPT. There is one application, another application, that is DeepSeek. And these are the few applications. In Canva, Canva is a tool or a website which is being used for the development of the posters, social media posters, and whatever the event posters, etc. So in that, AI is also integrated. If you go in the Canva, you have an option of Canva AI, and in Canva AI, whenever you write a command in the text, um, that is basically known as prompt. It's a technical name, prompt. And and there are so many other applications are also available on internet through which you can generate a proper prompt for your desired design. And after that, that prompt can be written into the Canva AI, and you can get this poster or any other things, whatever the video also you can create. Lot of AI applications are available. So that is basically the general AI. And I feel that these generative AI applications must be implemented with security, with guidelines, with ethical frameworks, with responsible implementation. These generative AIs, if we implement all these into sustainable development, it will help us a lot. Exponential speed we can gain in sustainable development if we go for the application of generative AI or general AI in sustainable development process. And you know that I think you may read here that OpenAI, DeepMind, Anthropic, these are the uh, top most artificial intelligence companies which are working for these generative AI applications. And day by day, you are seeing that these models are becoming much more intelligent with the help of a huge computational power. So that is basically the hard work of these artificial intelligence companies like OpenAI, DeepMind, and Anthropic. Now, super intelligent artificial intelligence, this is the next generation of artificial intelligence, which is very superficially implemented right now. There are very less applications, and a lot of things are going to happen because after super intelligent artificial intelligence, there will be a thing like it may surpass the humans in every field, including the creativity and decision making. So, a lot of companies are working on it in robotics, in drones. A lot of applications are being developed where the drones may take their own decisions, the robots may take their own decisions, and a lot of applications, robots you can see while in different AI technical expos. I think you can see on YouTube and different latest magazines of IEEE and other latest magazines you can refer for such kind of implementations of super intelligent AI. So there are long-term risk also, and it will lead to a AI dominance scenario. Policy debate is also there for technical capability. So a lot of things are there. Uh, Philosophical, ethical, strategic foresights required. Maturity is very low for these super intelligent artificial intelligence applications. So we are very less here, 10%, I think. But after 10 years, after 10 years, by 2035, you will see that we had not thought about um, this generative AI application, ChatGPT. In 2015, we have not we were not thinking about all such kind of things that the computer will work like this chat GPT. But here, right now, it is working. So by 2035, you will see that the super intelligent AI applications will also be available freely, and there will be some policy for their implementation, and there will be some controls of human on this super intelligent AI to control them also. By 2035, you will have lot of super intelligent AI applications in the society. Now, it is really very important that what is the role of artificial intelligence? If we define the term artificial intelligence, it actually there is one line. Artificial intelligence mimics the human cognition. So we will try to understand today that what is human cognition, what are the different activities in human cognition, and how can we implement all these with the help of artificial intelligence. So you see that in human cognition, perception is really very important. There are five perception organs in the human being. So visual, auditory, tactile input from senses, brain processes what eyes, ears, and skin detect. These are the some human cognition approach in this perception, that is sensation and recognition actually. So in AI, what are we doing? We are using computer vision. Uh, Computer vision is a technique through which machines can see. Speech recognition, uh, the machines can speak and the machines can hear. Sensor integration means it will sense, means sensor integration is just a technique through which you can implement these speech and computer vision techniques, because always we require sensors to have this computer vision and speech recognition. And for example, the artificial intelligence can play a role of image classification, natural language processing. Internet of Things is a very demanding technology right now with the help with for the implementation of the smart homes and smart cities. So IoT is there. So self in this category, self-driving cars can see with the help of the camera and object detection models. So this is basically the perception first first human cognition fact which can be implemented with the help of artificial intelligence. So now we move towards the attention and focus. Reinforcement learning. This is really very important, and it is being implemented in the robotics. Reinforcement learning. Reinforcement learning means it's a reward and punishment policy. If there is a robot and the robot is instructed to perform two behaviors, that it should not collide with each other, and the next one is it should not collide with the wall. So when it will be this robot will be used to check, will be tested in the room. When it will collide with the other robot, will have a punishment mark, and that will be done by this reinforcement learning. And if it is following the behavior, it is not colliding with the wall and it is not colliding with each other, then it will give a positive mark. So based on such kind of technique, there is a reinforcement learning. So this is basically the attention and focus, context aware filtering, attention layers in neural networks. Because neural network, I think, uh, because here term you have this term neural network, so I'm going to explain here in a few of the minute that what exactly is neural network, because that is really very important in connection with the human cognition. There is a term in computer science or in artificial intelligence, you can say soft computing. I'm just repeating it. Soft computing means uh, this is a computing related to artificial intelligence that has three broad categories. Number one, genetic algorithm. Number two, fuzzy logic. Number three, artificial neural network. So genetic algorithm means it is based on the Darwinian's principle of the survival of the fittest. So there will be a generation of the solutions, and then after they will be passed to a activation function. And the solution who will pass this activation function, that will be passed to the next generation. After number of generations, the solutions will be finalized. This is basically the concept of genetic algorithms, or in a very common name, it is also known as evolutionary algorithm. In that, there are a lot of other algorithms also. And in apart from this genetic algorithm, we have the next one is fuzzy logic. Fuzzy logic means we just think about our human decision making. We always say that today's temperature is very hot. Uh, Today is very cold. The car is going with a very high speed. The plane is moving with a very high speed. The plane is slow. So what are you saying? We are not saying like today is 45 degrees centigrade temperature. The speed of car is approximately 120 kilometer per hour, 140 kilometer per hour. We are not saying all these things. We are we are the good decision makers of the world, and we are totally working on the linguistic words. Linguistic words means the car is fast. What is the meaning of the fast? It is directly related to a quantitative word like it is 140 kilometer per hour or 130 kilometer per hour. But it is not quantitative. We are dealing with qualitative words. So now when we are going to implement this human decision making into computer, then there is a problem that how can we implement these linguistic words into computer? So that without mathematics, you cannot do anything, you cannot implement anything into the computer. There must be a mathematics behind this linguistic words to implement into the computer. So fuzzy logic is the first mathematical tool that can convert these linguistic words. Professor L.A. Jade in 1974, he first introduced that this how can you apply this fuzzy logic to mathematically implement these linguistic words, and how can you implement the human decision making into machines. So this is actually fuzzy logic. Then after I'm coming to neural network. Neural network is just like this is mimicking the functionality of human brain. Human brain is the collection of neurons. These neurons are connected with all these axons, dendrites. A lot of components are available in one neuron. So on similar concept, this neural network is also implemented. And the work of this neural network is to have memorized the things in computer, to have uh, to memorize and process the information very deeply. Now the deep learning word. Deep learning is totally based on the neural network concept. And in neural network, number of neurons are arranged into different layers. In that layers, we have input layer, then after hidden layer, and then after output layer. In hidden layer, you have n number of layers depending on the mathematics, depending on the model requirement, model capacity, and subsequently we have nowadays very powerful, even large language models are also using these chat gpt, through which chat gpt is developed. Large language models, they are also using these deep neural networks like rnn, recurrent neural network. So these are the different next generation neural networks that are basically known as deep learning. So this was about to develop how to attention and focus, that is a human cognition. How can we implement this attention and focus with the help of the neural network and all these things. Now, memory. And for memory, we have databases, knowledge graph, embeddings, and memory models like RNN, LSTM, neurosymbolic systems. We have these facilities in artificial intelligence, because I'm not going to very going in the very deep of all these terms. Otherwise, it will be very much late. So I'm just skipping this. Other applications are like human cognition activities are learning. For learning, we have machine learning, deep learning, online learning, meta learning, lot of transfer learning. In learning, computer learning, lot of AI applications, AI algorithms are available. They are working very well. As we remember the things, we learn the things from experience. So same on the same pattern, the machines are also learning um, from the data and past experiences also. Reasoning and problem solving, uh, they are also being implemented with the rule based systems, Bayesian networks, knowledge based agents, and decision trees, random forest. Lot of techniques are available for this human cognition implementation. Language and communication, we have NLP, large language model, GPT, etc. You are seeing right now, the computer is directly understanding. Even if I'm not writing a complete statement in the chat GPT prompt, but it is answering properly, and it is correcting also that, do you want to write do you mean this is the complete statement, correct statement? You can verify that statement that is being corrected by the chat gpt applications. So you are seeing such kind of advanced models and activities or facilities provided by the chat gpt applications. Decision making and action, goal based agents, reinforcement learning, multi agent systems, these are the important decision making and actions using artificial intelligence. So this is a chart uh, which is giving you a very brief description that how uh, cognitive processes are implemented in human brain, and subsequently how is it implemented in AI system. So you can go through all these camera, microphone, sensors, etc. So I'm not going deep into these because I think so, understood all, I explained all these things to all of you. So this is basically the chart, comparative chart, through which you can see that what is implemented by human brain and how can we implement in AI systems. Okay, now the most important thing, how artificial intelligence, because we studied lot of things, lot of facts about artificial intelligence, and now I'm presenting you that there are 17 SDGs, and how can you do with the help of artificial intelligence in each sustainable development goal. So for one, no poverty, what can you do? And this is really a very important guideline, I think I can say here, that you can create your own research problems to do with the artificial intelligence. Because for no poverty, you can go for predictive analytics for poverty hotspots, microfinance access. In sustainable development goal 2, you can go for precision agriculture, yield production, pest detection. These are only three, but there are a lot of applications in smart agriculture, precision agriculture, smart irrigation system, lot of things, lot of regional problems, local problems are also there, because agriculture on plain, agriculture on land, agriculture on mountains, agriculture on in a different geographic segment, they have their different ecosystem. So AI cannot be a generic solution for all the problems. So it can be addressed very well considering the local conditions, local problems for the agriculture activities. So accordingly, the AI can be applied. So a lot of research problems are available here. Apart from this, for good health, early detection, that is really very important. We know we are going to aware with the cancer in the third stage. So there is a big problem. We are going to have an awareness about the third or fourth stage of the liver problem. So if it is an early detection with the help of artificial intelligence, that will be very much helpful to all of us. Quality education. Now, artificial intelligence applications are playing a big role in the education delivery. For example, in education sector, even in case of engineering, in case of these uh, junior classes also, for the learning of students, small kids also, there is a lot of AI based applications, animation videos, which can take you more understanding for the problem. For example, in my time, how how am I understanding the digestive system of a person? It was presented. It was painted on a book. There was a figure that this is liver. This is the these are the different organs of the digestive system. But what is happening right now? I just seen one video created with the help of artificial intelligence in an animation, that the proper functioning was displayed. The proper functioning of the digestive system, our this respiratory system, all the systems, working of all these um, uh, systems like digestive system or respiratory system, they all are available in video, and they are properly working naturally in simulation. So you can understand that visualized data is much more important for the students, because it is it can be remembered for a long time. So that's why video and these pictures are really very important. And now we have a lot of facility to develop videos and pictures to pictorially represent to our students different data and all kind of things for better understanding. Gender equality, a lot of things you can do. Clean water and sanitation, affordable and clean energy. Lot of work is going on with the help of artificial intelligence and electrical engineering based applications. Lot of things are going on. So coming moving further, we have SDG 8, economic growth, decent work. So we can go for skill mapping. That is only possible with the help of artificial intelligence, because it will have a very huge data, and skill mapping will not be an easy task. So we can do this also. Intelligent manufacturing, predictive maintenance, inclusion analytics, bias audits, traffic optimization for sustainable cities, supply chain traceability, and emission forecasting, climate modeling, carbon tracking. These all can be done with the help of artificial intelligence. Life below water, marine life monitoring with the help of illegal fishing detection. This can be done with the help of the IoT applications as well. So, lot of technologies are also available apart from this artificial intelligence, like Internet of Things, blockchain, and quantum computing. They will also help in implementing solutions for these sustainable development goals. Life on land, deforestation tracking. This can be done with the help of uh, the satellites also. Peace, justice, and institutions. The most important thing is fake news detection. Really very important. So I will suggest, if there are some students from or participants from the engineering background, I will suggest that you have to work for the fake news detection. The fake news detection, the recent research problem is that in video, uh, we cannot analyze that where is the content which is not appropriate in video. So we can go for the deep learning based models, development of deep learning based models, where we can detect that where is an inappropriate content inside the video. that will help a lot, because in text that is possible. Lot of natural language processing NLP based applications are there. Lot of things are there. Cyber crime prevention, that is also there. Justice analytics, that is also possible. But there is one problem, that in video, how can we identify a specific location where the content is inappropriate? Partnerships, uh, because there is a multilingual models, knowledge sharing, that can be done with the help of artificial intelligence. Now you can see that a lot of uh, even institutional organizations like UGC and AICTE here in the India, they are also uh, promoting the teachers and the students also to work in their regional language. For example, there are so many books are being written by different faculty members, that Python in Hindi, Python programming, but that book is written in Hindi. Microsoft Excel and all other supporting these very computer diploma kind of thing, they are also available in Hindi program, Hindi language. But Hindi language is common in North India, but in other regional languages like Tamil, Odia, they also promoting. Recently, I joined a meeting of UGC. They also promoting to work in their regional languages. So that is also possible with the help of artificial intelligence to interact with the persons which are multilingual. And one more thing that I want to suggest here, as I suggested in the detection of the inappropriate content in a video, I will suggest here that there are there are very less applications to communicate, to establish a communication between the multilingual persons. So we can go for the AI based application development, where we can provide easy, cheaper applications to the society to come to provide facility to interact to multilingual person. There is a requirement in the market. All right. So now, uh, what are the cross-cutting synergies and challenges that AI plus big data? This will enable real-time SDG progress tracking. AI plus big data. I just want to explain here what is big data. So, for example, in my university, there are 25,000 students, and
Sir Ravi, excuse me.
no,
We have a panel for you. We have a set of questions ready for the after your lectures get over. So could you wind up your lecture by around like by 7:45?
all
Yeah,
right.
so that we can start.
Okay, okay.
Thank you.
So, in my university, we are collecting the data like name, enrollment number, university number, and a few of the other information about the parents, address, etc. So these information we are collecting. So this the size of this data is very low. This is not a very big data. But when we are going to process the data like video data, for example, I'm putting here one example that I want to analyze the CCTV camera videos of the city of Lucknow. So now you can see that you cannot store this data at one place. You have to put this data into different distributed places. And then after you have to apply some distributed kind of algorithm. And the size of data is too large. You have to increase your computational power with the help of GPU also. Then after you can go for the analysis of all such kind of data. And this data is known as big data. So in case of this sustainable development, there will be so many cases where the data is too large to analyze this data. We have to go for the big data applications. Like for example, Google is using Hadoop technology. So that is dealing with the big data analytics. So AI plus IoT. IoT can help in different agriculture, clean energy, and urban sustainability applications. And then after AI plus blockchain, AI plus robotics. But the challenges are like bias and fairness, privacy and security, capacity gaps in the global south, need for ethical frameworks and governance. I will put here one example for you, that what is biasness and fairness. Uh, for an AI for this AI application, it is totally based on the data supplied to the model. sometimes what happens, there are two things, underfitting and overfitting. Underfitting means the amount of data is low, it is not sufficient, you can say. And overfitting means the data is uh, too large, that the model is not accommodating the complete data. That's why it is deviating from the decision, whatever is there. So after that, the machines will understand, will be learning through their own experiences. So what happens? Sometimes the machines are going to be inclined towards one decision due to the problem of the data, or you can say that this is a poor data. The quality of the data was not good. That means there was some missing data, or there was some data with the error. So that's why they are not taking the proper decision, and they are inclined towards a decision by mistake, or you can say that by some problem in the data. So that is a case of biasness. The second case is that we are human being, and we can interrupt in the decision making of a machine learning model if it is not properly and it is not securely implemented. So what will I do? I will inject something, some code into the functioning of that machine learning algorithm, and it will be uh, deviated from the decision. That means it will it may incline for a decision by the injection of the code that I did this in machine learning algorithm. So that may also be a case. So to avoid all these things, we have to go for a privacy and security, and there should be a need for the ethical frameworks also, governance. There must be a policy for before the implementation of all these things. Now we have some of the AI innovations and inventions in global south. That means you can see here that in agriculture, in India, Kenya, Nigeria, and Brazil, we have lot of AI-powered precision farming and soil analytics based these inventions in the global south specifically. So these all are countries from the global south, and these are few of the innovations which are related to healthcare, education, financial inclusion, climate and disaster resilience, and urban management. So these are some of the innovations. Now you see that these are some startups and projects in global south related to AI innovations and inventions in India, Kenya, and all these countries are given over here. And these are the AI innovations. And what is the description of that AI innovation that is mentioned here? And these are basically related to all sustainable development, like palm oil processing, AI controlled drones, reduced food waste, pest prediction, and this Bangla speech, AI driven Bangla speech recognition and text analytics, AI for BD. Salarium, this is for the payroll and worker financial analytics in SMEs. Now, how AI transforms healthcare delivery. Actually, from this place, we are going towards the specific domains of healthcare, and then after I will be coming with this other application area. So this is healthcare delivery. There are so many functions in this healthcare delivery, like diagnostics and triage and decision support, drug discovery, medical imaging, remote monitoring, telemedicine, and epidemic prediction, mental health. So all these things, or in all these functions, how can we implement AI that is mentioned over here, and in which SDG, because it is directly related to SDG 3. So what impact it can give on the sustainable development goal 3 that is mentioned in the column 3 that you can see here. So these are the different AI applications that you have in healthcare sector. And these are some case studies from the global south. Uh, what is the AI solution? This is basically actually implemented here. And what is the impact that you can see here? And what are the challenges? Data privacy and consent is really a very big challenge, because The data is related to the patients and it cannot be revealed in public for any kind of application or any kind of analysis. So there must be a mechanism for the data privacy, uh, and consent mechanism also must be there for the release of the data. Bias in AI models, that is once again a big problem. Affordability and scalability is also a problem. A skill gap. Every doctor is not aware with the AI, and because whenever you are going for the AI implementation in your clinic or in your hospital, you have to train your doctors and nurses separately, and accordingly you have to plan your ecosystem and your human resource also. These are some solutions and enablers that you have: open health data, low cost AI platforms. These are the different things that you can see here. In future, uh, if we want to have AI in the next generation implementation of AI, we can say in healthcare acceleration, we have digital twins. This is really very important. AI in genomics, voice AI plus NLP, and AI epidemiology for real-time pandemic defenses. So these are these are few applications which can be implemented in future for the health acceleration. Now, this is a climate action based on the similar pattern. I prepared it for the climate action because that is related to Sustainable Development Goal 13. This is climate modeling, disaster prediction, remote sensing and monitoring, emission monitoring, energy optimization, urban climate solutions, climate smart agriculture. These are the different areas in the climate action, and how AI can contribute. How is it impacting to the sustainable development goal? That is also mentioned properly here. Like lot of things in which AI can contribute. You can see climate trends prediction with the help of deep learning, and floods, cyclones, droughts. AI augmented satellite data-based prediction can be done. So a lot of AI applications are available in this area also. These are few of the AI climate innovations. In India, IIT plus IBM AI for monsoon prediction and smart irrigation. AI in smart grids to balance wind plus solar. This is from China, Kenya, Brazil, EU. They are also developing a lot of doing a lot of innovations in this area. Challenges are like data availability and quality of the data is also a very important concern that I already told you. uh, Model transparency, unequal access, over reliance on AI, and energy use of AI models. Apart from this, emerging trends, which are now very much emerging trends in smart agriculture, smart climate action, that digital climate twins, AI plus IoT mesh networks, AI in carbon markets, geo AI, regenerative AI. These are the future applications. Means you have a lot of research opportunity in these emerging trends. These are few of the enablers like open earth data, green AI infrastructure, global south collaboration, AI for climate finance, AI literacy for climate experts also. So these are few of the enablers for scalable AI climate solutions to support a sustainable development goal 30. And this one is SDG financing. Financing is really a very important concern. Uh, I will suggest that in future, blockchain technology will be implemented in all the financial transactions, so that we can reduce the corruption at a very we can reduce the corruption in future with the help of this blockchain technology, because blockchain technology is the technology which will have all the marks of insertion and deletion of the data. So corruption or manipulation of the data is not possible. It is possible, but it will be recorded. So that's why the people will not do the insertion and deletion, which is not ethically correct. So that is basically the implementation of blockchain technology in financing applications also. So these are some of the functions like prioritization of funds, risk assessments, fund allocation optimization, fraud detection, impact measurement, and investor matching also. And how AI can contribute, you can see, and what is the outcome. We have green bonds, impact investing, development ad, climate finance. These are some huge cases by financial instruments that you have. So this is challenges, data gaps, infrastructure deficit, and bias and fairness, regulatory complexity, privacy concerns. These all are the challenges while implementing these SDG financing mechanisms for sustainable development. And these are some priority area where what the action must be taken. These are the few of the priority area, like budgeting tools, impact audits, finance AI coalition, and AI taxonomies, credit ratings. Here you can easily apply the artificial intelligence. After that, we have the future of AI in SDG finance, like SDG investment co-pilots, global AI SDG fund platforms, synthetic impact modeling, AI in development bank lending. These all are the future applications or the future of AI in SDG finance. You know, now there is a brief about data, ethics, and AI biases. So here you can see that data is very important. Training data, testing data, and data is basically the main fuel to operate the machine learning and deep learning algorithms. When data is poor, data is ill, data is sick, it is not in its proper format, or you can say the values are not correct, then there must be a decision effect on the decision. It may be biased, or it may lead to a incorrect result, which may lead to a false decision also, incorrect decision also. So that is not basically uh, that should not be possibly implemented. Means the data curation is very important, and there are some ethics concerns. And finally, we should not go for the any kind of AI biases. Now, you see, these are some of the concerns like transparency, privacy, fairness, accountability, inclusivity, human control. So these are some descriptions which are related to data and ethics. So now you see uh, what kind of biases can be implemented by some in unauthorized access of the data. That means data bias, labeling bias, algorithmic bias, historical bias, or deployment bias. Means the biasness can be implemented at the data level, at the labeling level also. Algorithmic level means there may be some changes in the algorithms also. The historical biases means the past inequality and in the training data. And deployment bias means in the context of use differs from the training also. So these are some of the examples which are related to the biasness of the AI models. And what are the risks associated in different SDGs? Because in health, whenever we are implementing this AI model for any health kind of decision and it is not taking proper decision, it may lead to a problem to a patient also. So health, education, gender inequality, all these things uh, may have the risk of AI bias while implementing. And how to mitigate bias and promote ethics in AI, that is really very important. Diverse training data, bias audits, ethics by design, human oversight, and global standards, etc. These can be implemented. And there is one thing, that is digital divide, because lot of digital infrastructure is not equally distributed throughout the globe. This is really very important. So digital divide is there. So the governments, the policymakers must take care of it to have a equal digital infrastructure implementation, means internet facility and all other kind of electronic facilities. So this is basically the bridging strategies. What can we do? These are some challenges also. This is case studies and global initiatives, role of stakeholders also. Lot of things which can be used in digital divide, case studies and global initiatives, role of stakeholders, and challenges and risks in AI driven SDG attainment. This is also a very important concern because whenever we are going for AI driven implementation, there are a lot of risks also, which I was discussing in the previous slides also, like data related challenges, ethical and governance related challenges are also there. Socioeconomic disparities, are there. Lack of capacity and infrastructure is also there. That means digital divide kind of thing. Environmental risks are there, e-waste generation, high energy consumption, etc. And then after the measurement and impact attribution means difficulty in tracking SDG contributions, short-term versus long-term goals. A lot of things are there which are coming as a challenges and risk in AI-driven implementation. Security and safety threats, cyber security, etc. Algorithmic transparency and trust. This is also a very important concern. After that, we have partnership and global governance cooperation for a responsible artificial intelligence future. This is really very important. AI is a borderless, so global cooperation is essential. And goals of responsible AI cooperation like fair and inclusive development, safety, transparency, accountability, all these things must be there. So partnership and global governance is very important because SDG sustainable development is not a concern of a country; it is a concern of the complete globe or the earth, we can say. So across the boundaries, we should come on one platform and we should work on this AI implementation for the sustainable development goals. So few of the initiatives and forums are mentioned here. These are some strengthening multi-stakeholder partnership, civil society engagement, and all these. Partnership and global governance cooperation for a responsible AI future. After that, partnership and global governance cooperation for a responsible AI future. These are something that you can see. And this is the last phase of the presentation, that what are we expecting in AI for humanity by 2030 and beyond. That we want an inclusive digital world, number one, and sustainability by design. Uh, that is also very important because AI becomes the nerve center of sustainability. Climate models, smart agriculture, circular economy models, lot of things are there. After that, ethics is very important. Every line of code, that is very important. And AI as a partner in global cooperation, this is one of the important things. Co-creating a conscious AI future, that is important. And innovation serves human dignity. Algorithms reflect social justice. Machines amplify human compassion. 2030 is not the end. It's the beginning of a more human, more united, more intelligent world. That is basically a concluding remark. And this is the concluding thought that as we look towards 2030 and beyond, AI is no longer just a technological advancement. It is a transformative force shaping the future of health, education, climate, governance, and justice. However, realizing AI's full potential for humanity requires more than innovation. It demands inclusion, intention, and integrity. So, AI must not only be powerful, it must also be purposeful. That is really very important. Responsible collaboration is required. Shared values of humanity and sustainability is also required. And this is the last slide of this presentation. That few of the takeaways, like AI is a catalyst for sustainable development, and equity and inclusion are not negotiable. Global cooperation is crucial. Ethical, transparent governance must lead the way. The future of AI is human centered. And the last thing, that let us co-create a future where artificial intelligence doesn't replace humanity but reveals the best of it. Thank you so much. Maheshwar sir, can we have time so that we can show the program that I was intended to show, if you allow?
You have how much time do you need?
2 to 3 minutes. It will take two
Fine.
to three
Right.
minutes.
Yes, yes. Please go ahead.
Okay. So I'm just putting here one smart agriculture application. It is a very, very small application that can be uh, used to classify the pictures taken in the farm of potato crop, that what is the health of the crop which is of potato. So let me explain here a code in a very technically, but very in a very I will explain it in a very simple way. This is basically a Python platform, Python programming platform, and this is Jupyter platform by the name, and it is coming from Anaconda platform. So in this, we are using TensorFlow. This is one of the library in Python, and we are also using Keras. Matplotlib is used for the displaying the information. Here we are putting one data as we were discussing about the data. This data is stored in the F drive of my computer with the name of plant village. Inside this, there are three folders, three classifications, in which in one there is healthy leaves of the potato crop, and in the second one there are average health potato leaves, and in third there are the potato leaves with some disease. So we have to train this model. You can see here that 2150 files means 2152 pictures are available for these leaves. So accordingly, I'm going towards this. I'm just showing with the code. These are the different leaves that are stored in the database data set. So you can see all these leaves. Sorry. After that, we are creating this model. This model is implemented here in this code with the help of Python. And then after, we are going to train it. So with the help of training data, 54 leaves, we are going to train it. And after training, you can come to the, this is whole procedure for the training. And you can see here that this is the model summary. You can see this is sequential model. Convolutional 2D matrix will be used. These are some technical words that are being used for this model implementation. And you know, you see, these are the training. You can see the complete training procedure. This you can understand. Everyone can understand. These are the different epoch. You see that there are 50 epoch. You can see that it is starting uh, from this place 54 by 54, and now you can see that these training is going to complete. Loss is 0.1743 and accuracy of the model is 0.9302. It's going on. So we are coming with the last. This is the last final model. Here the accuracy is trained model is 0.9427 and 0.1411 is the value loss. Means this is the fault that we have in this model. It is very less. So now we are going to evaluate this model. It is 0.9889844. That is very much efficient model. And after that, we are going for the uh, accuracy of the proposed model. So you can see that this is the training and validation accuracy here. It is starting from 0.7 it started, and it goes up to 0. More than 0.9521. So this model is working very well. And now this model is designed, and any of the data set from a fresh, for example, in today, if I take one data set from some of the farm, we can test that data set into this particular model, and it will tell you in 1 or 2 minutes that what is the health of your crop of potato in your farm. So this is basically the implementation of deep learning model for a smart agriculture implementation to identify early identification of the diseases in the crop. So thank you very much. I hope that you all have uh, now you are uh, well known to the SDG AI and other things. So I tried my best. Rest is up to you.
And
That what is your feedback?
no, you didn't just try your best. Actually, I think you did a wonderful, excellent job. So, we shall go ahead with a small panel discussion wherein I'll be asking you a few questions, Professor
Yes.
Sukla. So these questions are set. Many of the questions you have already responded to in the form of your presentation, but this is all these questions will give you an opportunity to maybe expand on them more. Yeah. So I'll start with the second theme. We have 9 themes here, and there are questions under that. And I'll be reading all the questions in one go if you want that, or I can read them separately as per your choice. So there are 3 questions for each block as per each theme. The first theme is health, education, and human capital. So question number 1 is, in what ways can the AI bridge gaps in primary healthcare access and diagnostics in underserved and rural populations across the global south? And second, what role does AI play in reimagining inclusive education systems, especially for
No, I think
marginalized
I think
learners
I
and
will reply one by one, sir. So the first
okay,
question was related to how can we
okay,
access the
let me repeat it. In
yeah.
what ways can AI bridge gaps in primary healthcare access and diagnostics in underserved and rural populations across the global south? So please be precise because we have a lot of questions.
Okay. So artificial intelligence can help in accessing this primary healthcare system because we have we there is a requirement to develop such kind of applications, Android applications or any other AI based applications, which can provide you the information that what is the place or where in which hospital you can get the medical support much more better for a specific disease. For example, you are suffering with some digestive problems, so where is the location of that medical facility where you can get the support, best support for this particular problem. So these recommender systems can be developed for accessing this primary health care that you have. So
As the
second question.
CEO, as the CEO and founder of Global Consortium of Global Health, led by Global South actors, leaders, and thinkers, I'm based in India, so electricity may go out anytime. So I have put my
Okay, no
mobile
problem, sir. You are,
light on,
you,
and I'm
yeah,
going to yeah,
no
I'm
problem, sir.
going to talk to you. So we are ready for everything. We are ever ready. You know, that battery ad used to come in our childhood, if you remember. Okay, so the second question is, okay, that takes care of it. So what role does AI play in reimagining inclusive education systems, especially for marginalized learners and those with disabilities?
I think, sir, for there is a thing like digital divide we already discussed. So the government should take care of it, or other social service persons can think about it, that how can we provide the digital facilities, digital learning facilities to marginalized persons. So accordingly we have to plan for those persons also who are marginalized, and the, the delivery of the education, the delivery of the content with the help of the AI supported or digital supported systems is much more effective compared to the traditional. So we have to take care to implement all these things in that society also. But it is a matter of policy,
Definitely.
matter of the implementation. How can we implement?
Absolutely, absolutely. Yeah, so let me go to the last question in this block. How can AI-based predictive analytics revolutionize public health interventions for SDGs such as maternal health, nutrition, and pandemic preparedness?
Okay, for this, I will suggest that there must be a AI-based mechanism so that we can identify that what are the different places where such kind of things like nutrition-based problems are much more there. And after the identification or recognition of the local reasons related to that particular problem, and that then after that, the policymakers and government persons may address the problem associated with that. So the solution is that we can identify the local regions where such problems are existing, and then after we can address the solution.
Definitely. Okay. So the next set of questions are on climate change. Uh, yeah, on environmental sustainability and climate action. So, how can AI be deployed to combat climate change, enhance environmental monitoring, and support adaptive strategies in vulnerable geographies?
Nowadays, geospatial satellites are there, so they are monitoring the environment and all other weather conditions, weather patterns on through the these satellites. So we can analyze this data with the help of deep learning applications, and accordingly now correct predictions of the weather can be done. And if there is any climate shift or climate change, accordingly we can plan our agricultural activities, so that it will always help us to pre-guided for the agriculture activity.
Definitely. The next question is, what innovations in AI are helping local communities in the global south predict, mitigate, or adapt to climate-induced disasters like floods or droughts?
I think it is on similar basis that, but I can add one thing here, that IoT based applications or IoT based systems can be implemented with the rivers, so that we can get an early alarm that the flood is going to happen. Because sometimes what is happening, flood, we are not aware with the flood, and in that case, lot of loss is happening over there. So IoT based systems, basically that is a sensor based system, Internet of Things, that will be connected with the Wi-Fi, and solar power based IoT network should be implemented at the different places of near about this river. And it can implement, it will send the alarm and information that there is a flood situation.
Yeah. So, can AI meaningfully contribute to circular economy models by optimizing waste management, water use, and energy consumption in emerging economies?
Yes, it can be there. I'm not an expert in this circular economy. So, but it can be used. It can be used everywhere.
Okay. So we go to the next block of questions, which are on economic empowerment, jobs, and industry 4.0. Now we are moving fast towards industry 5.0. Some people have even started writing books on industry 6.0. I don't know what they are imagining. But anyways, we are still on industry 4.0. So let's focus on that. Question number one. What scalable AI solutions exist for transforming informal economies, agriculture, and MSMEs in the global south?
What, sir? Can you repeat the question?
What scalable AI solutions exist for transforming informal economies, agriculture, and MSMEs in the global south? You talked about
So
agriculture.
I think a lot of startups are there. I already mentioned in the presentation. Lot of startups, lot of innovation projects going are going to happen, and they are happening. They are working also. So a lot of innovations are happening right now.
Definitely. So we are hoping to have a better future, maybe,
Yeah.
hopefully, industrial growth and expansion, better futures. Okay, so how can AI support decent work, that is SDG work, 8, when automation threatens to displace low-skilled jobs in developing nations? Some questions have come in the Q&A also regarding that.
So it is related to jobs.
Yes. Because some
Okay.
people are
So
thinking like
yes,
AI will
yes,
take away
yes,
their jobs.
yes. Actually, this is not the loss of jobs. It is an employment shift. But the thing, I feel that when there is an employment shift, for example, in the office of a newspaper, there were 100 news editors. But now we have only 5 to 6 news editors, and 94, 95 editors are not on the job because of this application of ChatGPT, for example. So it is a big problem that what is the solution for these 95, 94 persons. So I think there must be a policy before employment shift. We or organization must think about the persons, that what will be the next opportunity for them. There is one solution for it, that there is a there must be a program or policy for re-skilling. So
Definitely.
government and policymakers must think about this, that who are the persons. The number one thing is that who are the persons who are losing their jobs, number one. And number two, what is the solution for them? That means how can we re-skill them for their re-employment. So in this way, and AI applications must be developed to analyze this data, and accordingly, the policymakers and governments should take care of it.
Okay. The next question is associated with that. What mechanisms are needed to ensure that AI driven economic development benefits women, youth, and indigenous entrepreneurs?
Sir, actually, your voice is not clear sometimes. So, can you repeat
Okay,
this question?
yeah, what mechanisms are needed to ensure that AI-driven economic development benefits women, youth, and indigenous entrepreneurs?
Okay, AI-driven economic development. Actually, AI-driven economic development is fast and it is secured also, because you can see that now we are not going to the banks. Uh, we are saving our time. A lot of applications, banking, financial work we can do from our home. We are rarely visiting banks. So in future, with the help of the artificial intelligence, you can get recommendations from your bank also, that where can you go to deposit your funds, what should be your financial plan. They all must be done by the help of this artificial intelligence. So you may have a recommended system, and they may have a recommended system for your skill reskilling, your skill programs, and that is the way through which you can get the help from the AI application or AI based economic development. And
The
obviously,
next
when
set of
AI
questions.
will be implemented in the economic development, there will be jobs for the engineers, because new jobs are being created. Now, content creator is a best job, I think, in industry. Many of the
Okay,
engineers are working for the content creation.
definitely. So the next set of questions are a little serious. Data, equity, and localization. I know you have covered a little bit about it, so I would like you to expand on that. The question number one: to what extent does the dominance of data from the global north skew AI solutions, and how can we localize AI responsibly for the global south?
The responsible use of artificial intelligence is really very important. Either it is in banking sector or any of the sustainable development goal, the implementation of responsible artificial intelligence, and it is very important. And if it is, we should take care while implementation of this artificial intelligence, that there must be some guidelines, there must be some policy, there must be some frameworks, and there must be some AI driven monitoring mechanism, that it is responsibly implemented or ethically implemented or not. So there must be a mechanism.
Okay. The next question is, how can we ensure that AI models trained on biased or incomplete data do not perpetuate the systemic discrimination against the vulnerable groups?
It's a good question. uh, Whenever the machine is not performing properly, there are already some guided systems at the outcome or the decision of the machine, that they will tell that this is not the correct answer. Like, there is a feedback mechanism system in AI algorithms mainly. So if the decision is not correct or not proper, then in that case, the decisions, there are two possibilities. Number one, to see about the data and data quality, and then after, number two, you have to go for the algorithms, means whether the code is compromised or something is injected into the code. There may be other possibilities also. So there is a pre-guided system at the outcome or at the decision of the machine, that if it is deviating from the desired outcome or decision, it must be recovered with the help of all these things, like data quality and unethical practices and algorithm code check, etc.
Yeah. Okay, the next question is associated with that again. What would an equitable AI innovation ecosystem look like for the SDG implementation in multilingual and multicultural regions?
I think it is already answered in the slide, that there may be NLP based systems, and there are so many systems also, that the multilingual persons can communicate with each other very easily. But that is sometimes very costly. So my suggestion was that there must be some AI applications which may be available for everyone. so that we can talk to other expert who is communicating in other language, in other language. Like, for example, someone is in Odia, so I know Hindi very well. So how can we communicate with each other? It must be available for a common man also.
Yes. So we are going there on infrastructure, digital divide, and access. The next thing. How can AI deployment be balanced with current infrastructural deficits like electricity, internet, and hardware in low-income regions?
So artificial intelligence can only analyze the data, and after analyzing the data, it will give you the information that following are the areas where these things are not available. So accordingly, the policymakers and government can plan to complete the requirements.
Yes. So there needs to be some amount of policy provisioning in that regard
Yes,
to
yes,
fulfill the demands, essentially.
yes.
Yes.
There is a
What?
huge requirement of implementation policy, because I think the government is also not clear, because AI is expanding everywhere, but there is no policy that what
Yes.
can be used for which purpose. Even the people are not understanding right now that to write the paper with chat GPT, it is still an ethical work or not.
Yes.
But the people,
Okay.
but in my point of view, when you are not, what is your contribution if you write a paper with the help of chat GPT? So I think it is
Exactly.
an unethical one.
Exactly. In our global construction, we have been
Actually, a
talking
paper,
about
a paper is a intellectual contribution of any person, not from AI.
exactly, exactly.
So I think I feel, but it must be written properly, and there must be a guideline. There must be a policy that this is not a intellectual product.
Let me
It
tell,
is not
share.
your work.
Let me share a little bit of experience from our side. You know,
Yeah.
in our global advanced certification program for the past 3 months, we are having a very intense research mentorship program for 300 plus people who are active in terms of research projects. They are working under our mentorship. So we are literally guiding them on AI ethics, digital ethics, and how to use AI responsibly. And we are also taking some examples from the global south as well as global north as to how they're really exploiting the power of generative AI to write papers and get it published also in top journals. And that is happening in a very rampant rate without the scanner, without true acknowledgement, authentic acknowledgement by the authors themselves. Although they claim big things on social media, many papers are getting published with the literal use of AI. They are like generated on AI itself. They are not even writing anything. They're just making some little bit of paraphrasing. So that is extremely concerning. So your concerns, I echo the sentiments completely. So I will go to the next question. How can frugal and low tech AI solution innovations be incentivized for scalable social impact in the global south?
Sir, can you repeat?
How can frugal and low tech AI innovations be incentivized for scalable social impact in the global south?
Not getting the
So,
question, sir. Can you simplify it?
okay, means low tech AI, like the cheaper, cost effective AI
Yes, yes,
innovations
yes,
be
yes.
incentivized so that more people get into the innovation ecosystem and invent more, and so that people, AI cost goes down. Basically, it's like a health financing system for improving the
All
innovation
right, all
system.
right, all right. Yes, yes, yes. But I want to give you one information here that this GPU, which is available on cloud applications also. So government of India is giving it free of cost with the some certain organizations also, that they are providing it free of cost. Chat GPT means this GPU for the computational power. If someone is going to develop some AI product.
Okay, right. So we'll now go to the next set of questions on global partnerships and capacity building. What strategies should be adapted to build the AI research and development capacity among universities, startups, and governments in the global south?
Actually, in India, there is a different startup mechanism. And in Uttar Pradesh, I think there is some state level also startup mechanism. The universities are providing their seed fund also. So here in this education system for startup and businesses, lot of support systems are available. And globally, we don't have any global policy for the startup and business, etc. Everyone has its own policy depending on their geographical region, financial condition, etc. I think so. So it should not be globally. It should not be a global policy for everything, because every country has its own financial ecosystem, on infrastructure system also. So as per the availability of the ecosystem and infrastructure, they have to develop their own startup support system or business system, whatever they have. But whenever they are interacting with each other, different countries can support to the countries who don't have any, who have weak financial infrastructure. So higher financial infrastructure countries may support to weak country, weak financial support, financial countries.
Yeah.
So
Okay.
accordingly, this can be done.
Yeah. Okay. The next question is a little bit more critical in terms of power relationships. How can AI partnerships between the North, the global North, and the global South be made more equitable, avoiding extractive and techno-colonial relationships?
Artificial intelligence based, yes, it is there. Actually, there are so many countries where digitization, and or you can say the digital products are not very much used due to unavailability of the infrastructure and lot of things, their financial structure and their development scenario right now, whatever they have. So in that case, whenever they are having on a global platform, then there may be a compatibility issue, that someone is very strong in artificial intelligence. They are doing their MOU, they are doing their all kind of their activities with the help of artificial intelligence and digital infrastructure, but someone is using pen and paper, or less than this also. So there may be a compatibility issue, uh, but I think United Nations SDG, they are working for the globe. So in future, the problem will be resolved with some policy and some solution, I think so.
Okay. The next question pertains to that only. What role can the multilateral bodies like the United Nations, WIPO, WHO play in ensuring AI innovation is aligned with SDG ethics and values globally?
Yes, I think if AI is implemented responsibly and ethically, the codes and everything are written, then it can be used everywhere. It is already satisfying the ethical responsibilities of SDG. SDG has not defined, I think, any advisory or any policy for the use of artificial intelligence. The only thing is that if you are implementing artificial intelligence responsibly and ethically, it is correct, means the data and algorithms are correct, then it can be used anywhere for any of the application. So I think there should not be any kind of problem with this.
Okay. So, but you do recognize that these multilateral bodies need to play an active role in terms of
Yes, there
designing the
must be
governance
a, there
process.
must be a guideline. There must be a guideline. For example, I presented here a lot of AI based activities which can be done through artificial intelligence for different sustainable development goals. The UN and other, I think they may be taking care of all these things in future also. That how can they develop a guideline or advisory for the persons, or the persons who are working for SDGs, that how can they use these artificial intelligence for this sustainable development. There must be an advisory or any support system. For example, if any AI product is being developed for any sustainable development goal, the funding must be done by the United Nations or the bodies, whatever you are naming them.
Okay. Right. The next set of questions are on ethics, rights, and AI for humanity. What rights-based frameworks are essential to govern AI applications touching on dignity, consent, privacy, and autonomy in development contexts?
Yes, it is a very important question. In case of healthcare system, whenever you are going for medical AI expert systems for diagnosis of the different diseases, the data protection is very important. There must be a consent from the patient, And if the patient is not giving consent, the data must not be revealed for any kind of research or any kind of purpose. So I think it is depending on the application area. In medical, we cannot compromise. In other systems where it is not the data, what is the actually we can say that what is the sensitivity of the data?
Yes,
That is really very important. If data is sensitive, then we have to take care of all these things.
exactly. Exactly. Okay. The next question is: can AI truly reflect humanistic values and planetary well-being, or is a new philosophical shift required in how we design the intelligent systems?
Sir, can you repeat? Actually, there is some problem in voice, sir.
Okay.
I'm not able to see clearly. Yes.
Can AI truly reflect humanistic values and planetary well-being, or is a new philosophical shift required in how we design intelligent systems?
Okay. So, artificial intelligence products are, they don't have any knowledge about ethical, unethical, or anything. Whatever you will guide, they will work accordingly. For example, there is a robot which is designed for the care of medical patients, but someone programmed in this robot that you can take a knife and you can kill any patient. He will do, because the robot doesn't know it is ethical or unethical. So the concern is that we have to take care of the security of the AI implementation, either it is in form of IoT, blockchain, or quantum computing, or in case of the artificial intelligence. Because this is just a cyber attack. We can change the programming of any robot by accessing its internal coding part. It will be doing a lot of other unethical activities. It is just a hacking of the system, because robot is nothing. It's just like a computer. It has hands and feet, and it's a human like structure, but it is a computer. So in that case,
Yes.
we have to take care make our systems robust and very secure, that no one can write a different code or for the different activities in the AI applications.
Okay. The last two questions for you. First, how do we build AI systems that are not just intelligent but also empathetic and aligned
Uh,
with human rights? How do we build AI systems that are not just intelligent but also empathetic and aligned with human rights and justice in diverse cultures?
Again, the same thing I will answer, that the AI system does not know anything, because we are in the age of generative artificial intelligence. Here everything is in our control. Whenever we will go for super intelligent system that I was expecting by 2035, then in that case there may be the different scenario. But here right now we have everything in our control. Accordingly we will go for the if we make a program for all these things, the robot or the AI system will do accordingly. So there is, I think there is no worry. But in case of super intelligent system, there will be a matter of worry, that what are they thinking, what the robots are thinking. But recently I came to one news that Chat GPT was asked by the administrator to stop, but that was not stopped actually. Chat GPT was working. So this was a very new incident, that how Chat GPT was working in that case. I just saw this in the news, that Chat GPT was not obeying the instructions whatever is given to him.
Yeah. Okay. So you were anticipating that it might take quite a bit of time to get fully autonomous
Yes,
systems,
yes.
which will have agentic features. Okay. Looking ahead, futures thinking. That's the last question to you. What would a future society look like in 2030 or 2050, where AI is fully integrated into SDG attainment process? What are the utopias and dystopias that we must prepare for, like the one that you just talked about?
I think, if I know, yeah, if I see about our country, there are so many places where there is a lot of problem for the connectivity, for the there are lot of other concerns except this SDG or digital development or AI and everything. There may be a problem of poverty also. So I think we cannot implement 100% artificial intelligence in SDG
Mm.
because it will be for all the geographical areas, and there are so many geographical areas across the world that they don't have sufficient resources to live their life. So what can we do for those persons? So we have to go for first we have to go for the completion of their basic requirements also. So this is the concern, that we cannot implement AI for everyone. There are a lot of other things also.
Okay.
So many
So,
persons are facing their basic problems.
so while you are optimistic, you are also skeptical about the possibilities and
No, I am optimistic. The governments and other persons who are the policymakers, they must make plan, and accordingly we must always be positive. Otherwise, previously I will tell you that there was AI winter, and it happened two times. In the If you consider the history of artificial intelligence, and I will recommend for everyone to study about AI winter. It goes for two times. It happened for two times. In I think it was in 1980s when there was no fund for the artificial intelligence activities. But now I think we are much more ahead, so it will not happen. But
okay,
anything can happen. COVID-19 was not expected, so anything can happen.
definitely. So we should be very optimistic, but at the same time pragmatic about the
Yes, yes,
future
yes,
possibilities. Right.
yes.
Okay. So with this, it is my utmost pleasure to uh, thank you once again from the
Okay, you
depths
are
of
most
my heart,
welcome, sir.
Professor Praveen Kumar Shukla,
Most welcome, sir.
for coming on the global stage of Global Consortium of Global Health. I, as the founder and CEO of Global Consortium of Global Health, and on the behalf of my entire team, Global Consortium of Global Health Access Leaders and Thinker, Global Health Forum, the Global Brain and Mental Health Forum, World AIDS Forum, and um, Artificial Intelligence Foundation of India, Global Psychiatric Association, and Bangladesh Institute of Innovative Health Research would like to place on record my sincerest gratitude for coming on a Sunday evening, sparing 2.5 hours of your valuable time and illuminating us with so much of valuable and very insightful lecture as well as the panel discussion. So it's been a wonderful experience. Let me apprise you a few things, Professor Shukla. This forum that we have been running for the past 12 weeks now has already benefited more than 4,000 participants from 170 plus countries in the world. And people have been attending on and off, and many of them also watch the YouTube recordings. They also watch the live shows on the YouTube. And it's been a pleasure as well as privilege to serve people in terms of knowledge delivery as well as exchange. And this is something which has been helping people bridge the gap and bridge the divide, and helping people to come together and share knowledge as well as many other valuable skills together. So as far as your contributions are concerned, you are now one of the official faculty members of the Global Advanced Certification Program, now that you have
Thank
come
you
and
so
taught
much.
for 2.5 hours. So our Global Advanced Certification Program participants would receive a certificate of completion if they are eligible, in addition to a statement of higher education achievement, which is in the framework of Australian and UK government education frameworks. And on that certificate, they'll receive that certificate will have your signatures, all the faculties, resource persons who have come so
All
far
right.
from all over the world, their signatures will be printed. So our admin team would be in touch with you very soon to get your signatures, and they would also request your slides. So hopefully you'll oblige us. And with this, I would like to request to do the last use before we close for this session.
Thank you, Professor Satpathy, and thank you so much to Professor Praveen Kumar Shukla, sir, for that insightful and forward-looking session on the intersections of AI innovation, and sustainable development. This session truly broadened our understanding of how futuristic computing can be harnessed to serve humanity and drive SDG attainment in a meaningful and ethical way. So we will now take a short 5-minute break before our second panel discussion. The second session focused on climate change, public health, and SDG progress in sub-Saharan Africa will begin at 8:30 p.m. Indian Standard Time. So please stay with us and return in time for another enriching discussion. Thank you.
Yes. Okay. So with this, thank you so much, Professor Supla. I am sure
You are
you
most welcome,
tired a
sir.
bit.
Thank you for inviting me. Thank you so much. And thanks, everyone.
So yes, we shall be in touch personally later. But for now, if you want to take a break, you may take. If you want to stay on board after some time, maybe you are welcome to join us again.
Please.
Because Professor Martha would be speaking after 5 minutes. So okay, participants, now we'll take a break about 5 minutes, and we shall return after 5 minutes. Okay, thank you so much. And all the participants, those who are attending the International Symposium on SDG attainment, please note that if you are attending the entire session in entirety, and at the end you are filling the feedback form, then you shall receive the certificate of participation for today's symposium. Okay, so only if you fill the feedback form. If you do not fill the feedback form, you will not receive a certificate of participation. Thank you. So we shall take 5 minutes break. Thank you. Professor Martha, would you like to check your slides?
Yes. Must I share the slides now? Because I want to share the slides, but I don't want to have my video on when I'm talking.
Okay, that's your choice. No issues with that.
Okay. So the slides are here. One second now. Okay. Let me share the screen, and then I'll check the slides.
It's coming up.
Okay.
Yes. Can you go full screen, please? Let's have a look if it is working.
If it's like this, can you see the slides in presentation mode?
Yeah. No, it is not in the presentation mode. Can you go full screen, like in the slideshow mode?
Let me wait. I think it's here. Let me do this.
It is showing two slides. One big slide, another right hand. It is showing small slide. Can you go in the full screen mode?
Okay. Yeah. I think this is the. Let me, because I have two screens open.
You have to go to slideshow and click on start from the beginning. Okay, that's how it works.
Okay. Okay, I'm here. You say I must go where?
I can see your slide. Yes.
Yes.
Can you go?
And then, yeah, that's what I'm trying to do. But because I have another. Okay, I know what I'm going to do. Let me stop sharing and start again, and then change the screen that I'm sharing. Yeah.
Yes, sure. Thank you.
Let me try again. I think this is the one. Okay, there. Okay.
Perfect. This is what I wanted. Yeah, great. But you have to go to the first slide because it's showing some other slide. Right.
Okay.
It's showing slide number 7, I think.
Oh, is it showing slide number 7 now? Okay.
Yeah.
Okay. Are we happy now?
Yes, perfect. Yes.
Okay, so maybe I will introduce, start talking, and then I'll start putting the slides on. And then if my video is off, will it be able to show the full screen of my presentation?
No issues, because your video will come in the right hand side, so in the Zoom setting of ours. So on video, in like on YouTube, your video would show in the right hand side, and the entire screen will cover the full slide. So it's perfectly fine.
Slide.
So yeah.
Okay.
So you have a choice.
No, I don't
whichever.
Yeah,
Whichever you
because
do.
sometimes my kids, they run around and I don't want it to show in case they start to come around.
Okay, no issues.
And
Yeah,
also in case the electricity goes. This is South Africa, electricity goes.
I know, I understand. That happened already twice to me, you know. So
Yeah, so at least if the video is off, then I'm not going to be in a panic mode. I will just nicely be able to continue nicely.
yeah, you can come back maybe during the panel discussion, you know, you can come back on video after during that time.
Yes. I think that would be better.
Okay.
Okay.
So I'll just take 1 minute break and then I'll be back. Yeah, sure.
Okay, sure.
Okay, so I'm back. Faisal, we can start now.
Welcome back, everyone, to our second international symposium. So we will now move into our second symposium of the evening under the Global Advanced Certification Program, GSCP SRCCER. This session is titled Environment, Climate Change, Public Health, and SDG Attainment in Sub-Saharan Africa. We are honored to have with us Professor Dr. Martha Chadia, Associate Professor of Public Health, Environmental and Occupational Health, Sefako Magato, Health Sciences University, South Africa, a passionate leader in global environmental health and development. Once again, this session will be moderated by Professor Maheshwar Satpathy, CEO and moderator, CEO and founder of Global Alt, and Director COE ECC PHP India. So I would request Professor Satpathy to introduce our esteemed panelist today and start the session. Thank you.
Okay. Welcome, Professor Martha Chadiwa from South Africa. South Africa is a beautiful country. I have lots of fond memories from South Africa. From my 2012 visit, I stayed there for 1 month in Cape Town and Stellenbosch. So I have lots of very fun memories and I have lots of very good friends from South Africa. So I'm very happy to have you here today. And we are
Thank
deeply
you so
honored.
much.
Yes, we are deeply honored to have Professor Martha Chadiwa today, who is going to speak on very interesting themes. So Professor Martha Chadiwa is a distinguished Associate Professor of Public Health at Sefako Magato Health Sciences University, renowned for her exceptional leadership in environmental and occupational health. Her impressive academic credentials include an MBA from Twente University, Netherlands, and a PhD in Public Health from University of the Witwatersrand, and a BEd honors in Education Leadership and Management from the University of Johannesburg. Her leadership excellence is demonstrated through her tenure as Head of Department Environmental Health at the University of Johannesburg 2012 to 17, where she spearheaded the development of the Masters of Public Health curriculum and pioneered an innovative MPA chatbot, as well as her influential role as Vice Chair of the EU21 Sustainable Development Goals Committee 2019 to 24. A prolific researcher and an internationally recognized scholar, Professor Chadiwa has established herself through extensive publications in high-impact journals, editorial board memberships across prestigious academic publications, and successful research funding from organizations including the South African Medical Research Council, a very prestigious research grant body. Her scholarly excellence has been acknowledged through numerous accolades, including being named among South Africa's Inspiring 50 Women in STEM 2021, receiving the Black Women in Science Fellowship 2025, and winning the Olympus International Award South Africa OIASA 2025. Beyond research, she has mentored several students to completion and remains deeply committed to community engagement through intervention programs, addressing public health challenges in underserved South African populations, embodying a transformative approach to public health education and practice across Southern Africa. Southern Africa is not just South Africa, it includes Zimbabwe and many other countries. Professor Martha Chadiwa has established herself as one of the leading authorities in environmental and occupational health, specializing in environmental and impact assessment, occupational health and safety, and community-based public health research in resource-constrained settings. She has a humble H index of 7, and with this very small but very humbling bio of Professor Martha Chadiwa, may I request Professor Martha to start our presentation. Our participants are extremely eager to listen to you. Thank you. The stage is all yours.
Thank you so much, Prof. And I was just enjoying listening to everything that you're reading. I'm thinking, oh, I have done all that now. That is so impressive. Thank you so much. And I really enjoyed the first presentation. I think it brought me to a nice, it gave like a good background on which I'm going to be talking about now. And I was given a very interesting task because I'm going to be talking about things that I have seen and things that I have witnessed and things that I have given my input on, and also experiences that I had to investigate and write about. So you will hear a lot of examples in my presentation, and I thought we'd be discussing with people. So I had put in my presentation such that I present and I talk, I give example, I ask for examples from others, but I'm still going to do it the way I feel is going to be helpful, and I'll be able to share the information. If you can see my slides, I'm going to start now, and then I'm going to stop this video. So please, I want to welcome everybody from wherever you are at, whether it's morning, it's afternoon, it's evening. Thank you so much for joining us today. So I'm going to focus on the Sub-Saharan region, where we are facing a triple threat of environmental degradation, climate change, and the public health crisis. And I think my talk that I'm going to give to you will explore how these interlinked challenges influence sustainable development goals and the pursuit of achieving these sustainable development goals that were presented in the first presentation, those 17 ones. So I'll try to break down that. Just to bring you to context, in the heart of our global community lies the Sub-Saharan Africa. And this is a region that has incredible diversity, resilience, and if I may say so myself, a lot of potential. And yet, beneath the surface of this vibrant continent lies a complex web of interconnected challenges that demand our urgent attention and if I can say, collective action. That's why when I got a Prof. Sadpath's invitation, I was like, this is what we need to be doing, collaborating from different angles. I bring this South African perspective, the Saharan Africa perspective, and we talk about the Asian perspective with the focus with the Indian perspective, so that together we can actually embark on a journey that helps us to understand how this environment, climate change, and public health intersect in ways that both challenge and inspire us. I hope this makes sense. So that this is not actually a presentation presenting problems, but it's a call for each one of us who's on the platform to recognize the profound interconnectedness of our world, and then the pathways towards the sustainable solutions. So this is what I'm going to be presenting. So first, I'm going to talk about I think everybody, the examples I would give from the African context, some may be aware or some may have read about it in literature, and it will be the first time, but I'm giving a perspective from my experience. The first one that we are battling with in Africa is the rapid urbanization challenges. We've got a lot of crowded cities where there is visible air pollution. And I know in Asia, specifically in Thailand, they have a similar problem. I was there 3 months ago, and we could, when you're traveling in the morning or late at dawn, you can hardly see the 50 meters away from you because of that air pollution. And then I want to also give you examples now from the sub-Saharan Africa, where we've got a city like Lagos in Nigeria, which has which is under a lot of pressure from people moving in and living in Lagos. It is home to over 15 million. And every morning they commute to different places. And every day they are moving up and down. And they are a floating slum built on silts over the Lagos Lagoon. And they face immediate health risks from different facets, from contaminated water, the thick air, from the vehicle emissions, and the constant threat of flooding from the sea rising levels. And then we've got children walking to school through these same streets, and we've got where there is open soil and rainwater. And the soil and the rainwater are just a breeding ground for cholera and typhoid agents. And then this same city is growing at a rate of like 3,000 people coming in daily. But we've got infrastructure that lags decades behind. But we've got people still coming in to the same city, creating a perfect storm of environmental degradation, climate vulnerability, and public health crisis. So this is just an example from one of the cities. And then we've got industrial growth and pollution, where we've got a lot of factories that are whose smoke stacks are just emitting pollution into the environment, and nothing, maybe if I say nothing, but little is being done to control the emission that is going into the air or into the atmosphere. And this, I'll give you an example of what actually happens in some companies in South Africa and in Zimbabwe. where there is an environmental impact assessment is done, and a company is realized that this company is emitting so much into the atmosphere, but it is employed so many Black people, if I may say, who are now benefiting economically from this establishment. Such a company can be exempted from any further penalties with regards to environmental pollution. I hope you get me. Yeah. So it means the priority now is being given to the people as economic growth rather than to this pollution that this same company is bringing to the environment. So it's just an interesting dynamic. I'll give you another example of Kinshasa in DRC, where there is also a rapid growth, where there is uncontrolled urbanization. And this city, from literature, it generates 9,000 tons of waste every day, but they only have capacity to properly collect 20% of the 9,000, which means that there is mountains of garbage that is decomposing in the tropical heat, creating methane, which is then released into the atmosphere, while also there is a contamination of the groundwater from these heaps and heaps of decomposing garbage. And then imagine now what happens during the rainy season. Because now there's also poorly planned settlements, and these settlements, they flood regularly, displacing people, spreading waterborne diseases. And Kinshasa General Hospital has reported that there is over 60% of the pediatric cases that present there, the problems are due to environmental health factors, from the respiratory infections caused by the indoor pollution to diarrhea diseases from the contaminated water. So I think you can see like where we are at, and how it's affecting us. I'll still come to now how the SDGs are going to come in place. Here, I'm just giving you a context of South Africa and how we need to be working, and then you will tell me, where do we start? So we also have these the climate change impacts that we think the droughts are being caused by the same things. We think the flooding are also coming from these, if I may put them as effects of the climate change. And then this is being experienced in these South African, sub-Saharan African cities. And there's enormous potential in sub-Sahara, but because there is this urbanization and we've got the industrialization, we are now experiencing all these climate extreme problems. And then we still, over and top of that, we still have to experience the demographic pressures that are straining the infrastructure that we have, the little infrastructure that we have, and also the ecosystem. And when we look at these factors, all of them, they converge to affect the human well-being in ways that cannot be addressed in silos. That's why this kind of a webinar was critical and very important for me. So you see, I'll also give you now examples of what is happening in some cities. And I'll seem like I'm going back and forth with some of the examples, because they will be applicable when I'm talking about the consequences, and then they'll be applicable again when I refer to what we need to do to be able to cover the SDGs, or to be able to attain the SDG goals. So, yeah. So I will seem like I've skipped some, but I'll still talk about them at a later stage. So where are the problems? Like, what are we doing, and what must be done? And you must realize progress isn't always progress. And as we witness this rapid urbanization where I talk about the potential that sub-Saharan Africa has. We see that there is the crowded cities which are choking with the contaminated air. But on top of that, there is industrial growth, which we all want so that we have the economic growth. But then that same industrial growth is bringing in a lot of air pollution in the major cities. What do we do? And then all this, it comes at a cost of environmental health issues. Because now we are being impacted by these climate change problems, because now we are vulnerable, because we are not economically stable. Now all these problems will impact us even more than it would have under normal circumstances. I want you to picture this. I've given you the example of Lagos. Now, can you imagine a young mother in Lagos who is watching as the city is growing around her? There is new buildings, there is new opportunities, but when you think about it, there is also new challenges. This is a young mother who is still giving birth, but and really wants to grow as an individual to make money. But to be able to grow, the factories must be able to be bigger and must be able to recruit and employ more. But this is going to cause air pollution. Now, this air pollution is going to affect the children, because the children are going to be breathing increasingly polluted air because of the increased industrialization that is taking place. But what should she do? The water sources as well that her family is going to depend on is going to be under threat of pollution. So this is just like a paradox of development without sustainability. But at the same time, are we able to sustain the development with the infrastructure that we have, with the number of people that we have, and with the resources that we have? Can we be able to control this? So we've got the air pollution, we've got the contaminated water sources, and this is bringing in the climate change and the vector-borne diseases that we have to deal with. And then, because of the contaminated water, we are producing probably the vegetation or the vegetables or the fruits that are going to even be problematic and not have the nutrition that they're supposed to have, because now they're probably even high in maybe fluoride or high in phosphate, which is coming from the pollution or any other nitrates that may be there. And we've got this fruit of vegetables that are not going to be good for the health, but that are going to be bad. And then we also have the continuous growth of these urban slums, which are continuously bringing in also health challenges. So this poor mother will be sitting here in Lagos and thinking, I want development, but this development is coming at what cost? I want you to think about it and reflect on it. And whilst you're reflecting on that, I also want to look at some data that I have seen that have been presented by the World Health Organization on the air pollution states and the number of deaths it's been causing. According to the World Health Organization, they've reported that 155, there have been 155 deaths per 100,000 people globally on average that have died from air pollution or air polluted ailments. And there's been over 900 million Africans that still rely on biomass burning for cooking, contributing both to air pollution and these respiratory diseases. So now it's like, what do we take as it's like a bitter pill to swallow, because we're still relying on this biomass burning for cooking. We can't afford the electricity. And we were joking even during the break to say, in South Africa, the electricity can come in and go as it pleases. we still even can't afford electricity from even the solar one or even the hydropowered electricity. We still can't afford it. So how do we even control this? Because it means even in the next 10, 20 years, or even the 5 years where we want to have attained the SDGs, we still cannot have attained them because 900 million people still relying on biomass burning for cooking. Really, we are not going to be able to make it. And then we've been seeing reports also from the World Health Organization saying that climate change is projected to increase the stunting rates by up to 20%. So it's like these aren't just statistics. This is showing you or presenting that there's millions of lives, families, communities that are still relying and living in the slums and having to face these environmental and health challenges. And the solution is not something that is in the next 5 years when it is projected that would have attained these SDGs. So this is just an example that I want you to think about. And I want you also to take you to Dar es Salaam, Tanzania, where oceans meet opportunities. Here in Dar es Salaam, a story is written in its coastline where there is 7 million people that it's it has more than there is 17 people are displaced on a daily basis as a result of floods, perhaps, or as a result of rainy or high rainy seasons. But this city is 7 million meters above sea level, making it one of the world's most vulnerable sea level rise. So you see that the Mbazi River, which runs through the city, it floods annually, and people are living in these areas. And these floods are getting worse and worse by the day. And I'd given the 17 people being displaced and killed sometimes due to the floods. This is getting even worse by the day. Meanwhile, this same city, it is reported to be one of the busiest in East Africa, where it is handling high volumes of cargo, which is bringing in opportunities for people, not only in East Africa, but in the rest of Africa. A lot of people go and buy things that they trade in, from electrical gadgets, clothing. They go and buy from these city ports in East Africa. And every day, the cargo volumes increases. And every day, people are thinking this is bringing in economic opportunity. But no one is sitting down to think about the air pollution. The air pollution that is coming from the diesel trucks and from the ships. Have we even thought about that? Do we even want to think about that? So it's like families still live in these places, and some of them, they are living in corrugated iron shacks, and they are staying there because they're thinking this is an opportunity hub. But these iron shacks, the corrugated iron shacks, they become ovens during the day. They are hot, extremely hot, and they freeze at night. While outside, the Indian Ocean is rising millimeter by millimeter each year. So can you imagine what's going to happen to this coastal city after maybe, let's say, in the next 5 years, when we are saying we should have attained some goals? We will probably have attained something, but we'll still be struggling with another problem. And then I want to give you another example again, as I also move on. If you go to Ghana, my favorite, every time I go to Ghana, I enjoy myself, and I love the food. It makes me forget about what I'm looking at and what I'm seeing. And I'll tell you that Accra Ghana, when you see it at face value, everything looks perfect. But they say every single time there is some of the places in Ghana would transform into a city of islands because of the flooding that is likely to happen because of where it sits. And this flooding, what does it come with? In 2015, there was flooding which came with an explosion of a fuel station. And then there was people were killed, but at the same time, there was a lot of water pollution and a lot of air pollution. And when you look at it, the city drainage system is built was built for a small population. And like I said before, we've got a very high urbanization, a lot of people coming in, but the infrastructure that we have in the area is not good enough. The infrastructure is meant to help a small population. It can't handle the intensity of the bigger populations that are coming in. But we are, with the coming in of the new president, President Mahama, he is even talking about a new economy where we've got a 24-hour economy from there is no sleeping, day and night, people are working. But no one is thinking about it. We are thinking about the industrial expansion, but who is thinking about the health of the individuals when we now look at the SDGs? Because all this growth and all this expansion, they come in with a lot of other people's priorities, like clean water, which is under the SDG 6, which I was talking about earlier, the good health and well-being. And then we are talking about poverty eradication and zero hunger and equal education. We are not worried about that. At this point, everyone is excited about the expansion that is taking place and not necessarily the health impacts that has on individuals. I hope you are still following me, and I hope you are not yet depressed as I am. And then we start to talk about the human cost of environmental stressors. We love the economic growth, and we really love when there is a continued industrialization, and we're saying we are improving as a sub-Saharan Africa, because we are trying to get to a point where we are also attempts to be developed. But we are getting to that development at what cost? That's what I want to talk about. There is economic growth, but at what cost? What are the things that we need to be looking at as we emphasize the industrialization and as we emphasize the distant work opportunities? What is it that we need to balance? I'll tell you a nice story about that happens in Kampala, Uganda. And normally we witness the realities, like every day. There is slums with poor sanitation. There's children suffering from malnutrition. There is disease outbreak linking to, which is being linked to climate changes because of the unsafe water from the flooding and also from the drought. And it's like these are not isolated challenges. They are interconnected. And every time you talk about these things, they're interconnected to the cycles of poverty and inequality. So I want to give you the example of the Kampala. Kampala geographically tells a story of inequality. The wealthy, they live on the hills, while the poor crowds live in the valleys. So the wetlands that should naturally filter the water and prevent flooding, there is people living there. But we can't take them away, because where should they be going? And in Blazy, a valley settlement, it has over 300,000 people. Families and in single rooms that flood nearly every rainy season. And in such places, I'll tell you, there is people that have given their testimonies of how they've lived their lives and seen and looked at the different lifestyles that they have to live with because of these geographical locations and because of the poverty and also the inequalities. There is a report from a case that was done by some of my colleagues in Kampala, where they followed a young mother of 4, where she was showing visitors the water line on her wall. This water line was as a result of the floods that came in and flooded their home. And she was also giving testimony of how her child has had diarrhea 6 times in 1 year. And how the local health clinics reports that 70% of the child deaths in the area is actually from diseases that are preventable, but they are all linked to poor sanitation and contaminated water. And now, because people cannot afford the treatment, these children are losing their lives. I take a deep breath because these are preventable diseases. And what is causing this is poor sanitation and contaminated water. Think about this. And then when the rain comes again, the valley becomes a sewage. The whole valley becomes a sewage. Remember, there are 300,000 people living in these valleys, which just becomes sewage when there's flooding. And when they stop, the stagnant pools become breeding grounds for mosquito that is also carrying malaria and all these other diseases. So it's like we've got the people, the haves, the have-nots, and in trying to grow, there's problems. And now, what do we do? What do we focus on when we go to these places? It's like when we talk about the social inclusion, what should we be focusing on? Which pillars ensure that no one is left behind in the development process? Because we want everyone to be developed, but now what should we be focusing on? Now there is also this element of now saying we need to be protecting the environment. Are we able to do so? Are we in a position to be able to protect the environment? And as individuals, what can we do to sustain that development? I think that is the question that we should be asking. Like, are we capable? Are we in a position to control or to move on? Do we have the capacity? Do we have what it takes to be able to do that? So now, I also want to give you now other key sustainability challenges that we face in Sub-Sahara, and then give you examples of how we can or what has been happening in those aspects. You know, we talk a lot about climate change impacts, and I want to make you laugh about obviously the American president when the first time, I think there is a lot of records when there was this thing to say climate change is actually a fugazi, it's not real, nothing is happening. But here we are today talking about all these impacts and effects of what climate change has done to sub-Saharan Africa. So is this happening here only? Like, are we saying the developed do not see this? Or are we saying they do not feel the impact as much as we do here because of the resources that they have? Do we have the same resources or don't we have the same resources? What are we supposed to do? And even when we talk about this air pollution, like the developed countries or the richer countries, are they doing something to really be in a position to control air pollution challenges? Because when we talk of pollution, really, there is no boundary. You cannot contain air pollution. Like, if air pollution is happening in South Africa, it means that can also be in Zimbabwe, Mozambique, Namibia, Malawi, and everything else are closer to it. So you cannot say this is my air pollution and it's confined to South Africa. It is going to spread to the rest of the continent and the rest of the world. Same applies to these developed countries when they are doing when they are continuing with their developed and their industrialized nations. Are they doing enough to control or to combat air pollution, water contamination, the rise in sea levels, the rise in temperatures? Are they doing something? Because these problems are the ones that is leading to the water scarcity and contamination that we have to deal with, even us here in the developing countries. And then also in our quest to develop, we are accepting any money that comes from the developed world to say we are coming there to invest, but these investments are coming at what cost? Because they will come in and then we start to clear land, to put up this infrastructure, to put up these plans to say, because we have looked at the number of people that are going to be employed and benefit from these projects, but we have not looked at the deforestation and the land degradation that is going to come up out of that. We are continuously going into agricultural expansion, logging, and nobody is looking at that impact, because that impact is not being witnessed by the person, or is not going to be experienced by the person who is going to be having a new salary. It's not going to be experienced by the new family that just got employed in this new mining venture, which has been supported from UK, just as an example, or from America, just as an example. Because now we are looking at what we need. And what we need now is to be full. And we need the food security. We need that economic security. So it's like paradox. What do we focus on? What do we leave? And how do we manage it? And then I'm going to talk about the health inequalities, where we are saying in sub-Saharan Africa, we struggle with health inequalities and equities and the high disease burden, where we are saying people do not have access to medication, and people are being impacted because their immune system has been lowered because of the malnutrition that I already presented earlier on, where we are saying, are we eating food that still has the nutritional value that we were talking about? I want to give you another example just to bring you back again into context. There is a city, Freetown, Sierra Leone. They call it When the Mountains Are Weeping. In August 2017, Mount Sugarloaf wept mud and rocks, burying over 1,000 people alive. It was a mud slide. And the disaster wasn't natural. It was the result of deforestation and unplanned settlement. Obviously, we cannot exclude climate changes, and we cannot exclude the intense rainfalls that come with it, because as a result of the climate change. And then there were communities that were built on slopes, and they have no choice of where else to live because of the poverty that they live in. And then today again, there were people that survived that mudslide, but they're still there, and they live in fear of experiencing that same mudslide. But where do they go? They are living in poverty and they cannot live. So it's like, what do we do? What do we do? And now they also, there's children that are developing respiratory problems from the dust that is experienced during the dry season. And also there's a lot of waterborne diseases and rains during and flooding during the rainy season. It's like, we have problems. We come from one problem to another, and there is no, how can I say it? There is no joy and there is no, we can't win at the end of the day. But now, I gave you the pillars initially when I spoke about the social pillar, which we have to look at, the economic pillar, which we have to look at. But is there rather maybe a fourth pillar that we are forgetting and we should be looking at? I want you to think about this. I think I've posed this question before, and as I'm doing my presentation, I want you to continuously reflect and think back, and also maybe at the end you may give me, maybe you will have solutions for your areas where you're coming from. People right now, I think people, we should prioritize basic rights. Like, we should be thinking about clean water, we should be thinking about health, education, and food. But at the same time, we should be thinking about businesses, driving and building infrastructure, extraction of minerals, and just the general industrial growth. We should be thinking about that. But we mustn't forget that sustainable development requires harmonizing all these priorities to ensure that the economic progress does not come at a cost of human or environmental health. Does that make sense? So now it's like that fourth pillar that I want us to talk about or to think about is, could we be having a cultural sustainability in Africa? Would we have, like, is it feasible? Should we be thinking about that? Should we start to reflect on this kind of pillar so that we are able to attain the sustainable development goals? I know in the next 5 years it's impossible, because when I look at the unconfirmed reports that are there on what the countries in sub-Saharan Africa has achieved, it's like all the countries have achieved 1 or 2 SDG goals. No one has achieved, not even 5. I did not see one country. If you have seen, please share it with me. I have not seen one country that has attained 5 of the SDGs. And yet, it's 5 years from now that we are saying we should have attained this. I want to bring you back to perspective. Kigali, Rwanda. Kigali, Rwanda presents Africa's most compelling development story, a city rising from genocide to become a model of clean, green urbanization. And how do they do this? I think I'm trying to bring it back to say, if something is put in to become a culture, a norm, something that individuals take on, and it becomes their responsibility of what each person is supposed to be doing, then you are able to do something right. The city, Kigali, they banned plastic bags. And then they started to enforce strict building codes, and they would hold monthly community cleaning days called Umuganda. At this point in time, each and every person knew that at 12 o'clock midday, whether you're in an office, you're in an emergency, whatever you're doing, you stop, you go out, you clean, you throw away garbage. You do not find litter in Kigali. I have been to Kigali. I have walked the streets, and each time I'm shocked. I'm shocking, as we say it here. I'm shook. There is nothing. You do not see litter on the ground. Whereas here in South Africa, our culture is, I must throw the thing. What will those people that are supposed to be cleaning the streets do if I do not throw garbage on the street? You know, it's a culture dynamic. We have not put the responsibility on ourselves to say, I must be responsible for a clean city. It's still someone else who has to be responsible for it. And Kigali just showed us that it can be done. It's feasible, it's possible. So how do they do this? There was still tension between development and the health persists. The city's rapid economic growth has created jobs, yes, but remember, it has also created air pollution from the construction and the increased traffic. And we are still in Rwanda. There is that development. Of course, the streets, you don't find litter, but we have a new problem. We have air pollution. There is a lot of construction. We have increased traffic. And then we've got new commercial districts, small businesses that are thriving. The government now does not know. How do you now manage it? We've got lots of people now who are driving, which means emissions are there. It's a paradox. I need us to think about, how do we manage this? How do you control it? This is a real challenge playing out in real life, because we want industrial growth, but we still also want environmental protection. I hope you're still with me. And please still move with me. The indigenous knowledge that we had in our countries, I think in our setups, even in our cultures, like where we come from, I'll tell you the examples from where I come from. We were told that there is certain trees that you do not use for firewood. And I think the reasoning was, if we cut all those trees in the mountain, we are leaving the mountains bare. I don't think that there's a problem in using that a tree, but we just grew up knowing that there's a particular tree that you do not use for firewood. So when you go to the mountains or the forest, you cut everything else except for that particular tree. And you realize that particular tree is everywhere. And it is one that you know that this is the one that is very close, but you will be taught you do not use that one. If you use that one, you'll be reprimanded from the village head. Even people at your home, you'll be reprimanded. So it's like it helps you to conserve the environment and to preserve the environment. Shouldn't we be going to that? Because when big industry come in, do they look at that? Do they do a cultural inspection and a cultural impact assessment to say these trees should not be cut down? People actually are daring to that, or people are now focusing on the good products that are going to be produced by this company, and the money that people are going to get to develop themselves economically and change their poverty status. What are we focusing on? And then I know that when COVID came in 2020, it's like suddenly everyone was told you need to be immunized, you need this vaccine, you need to be vaccinated. But do you know what? We've got our traditional herbs that we normally use every single day that is supposed to boost our immune system. And they work just fine. I'm a very good example of those. I take ginger every morning. I take ginger every night. And I hardly struggle with small ailments. When you see me down, I'm really dead. Like I'm down from a very serious ailment. But the small things, they don't get me. I'm going up and down because I take those. And then COVID comes. Suddenly, we need to build this big this factory that produces these vaccines. What happened to our ginger? What happened to our lemon? What happened to our pepper? We know that this works and this helps, but suddenly we must take this chemically synthesized vaccination that later on we started to hear it could be having some side effects on us. I don't want to talk about that, but it's another thing that we could be talking about. Was that a sustainable health solution that we got, the vaccinations? Was that sustainable, or did it actually cause other problems that we didn't know about? And then we've got this community-based resource management. In our societies, we have people that have been teaching young adults, youths, young mothers on how to take care of themselves, how to take care of kids, and how to be able to handle their health in general. And from these, they also have people that now teach others or share family planning and then distribute family planning pills and teach. It's like the health education. But we had this even way before we had the people coming in from hospitals or from clinics or from World Health Organization. Our culture has people that used to teach us. You know that at one point you go to your auntie, you sit and you listen to what they have to teach you and what has to be done. And you know that if I do this, okay, I do not need to use any family planning. This is my cycle. You are taught, you know, there's things that you are taught. I'm not going to teach you now. But there were things that we were taught, and it was something that was done in our communities. Should we continue with that? Does that help us to also preserve the increase or the population growth that happened in the urban areas? And are people missing out on that? Or have we forgotten about that? Or what is happening? And then when we come to the cultural values and the environmental responsibilities, we tend to give this to somebody else. It's like we take the responsibilities and we give them to another person. It's like it has nothing to do with me, but maybe the municipality should be doing this, or the government should be doing this, or UNESCO should be doing this, a World Health Organization should be doing this. There is never something about what I should be doing as an individual. Whereas when we start to think about sustainable development, let's start to focus on individual. What can I do as an individual to be able to attain these sustainable development goals? What do I do? How do I contribute to these? And then how do I take myself accountable? How do I make myself accountable? Not even as an academic, but as a person, as Martha, as a mom, as a wife, as a community member. What do I do? Like that is going to add on to the community being taken as a community that is contributing towards the sustainable development. It's food for thought. I would want you to think about it. Because the reason why I am talking about this is because Africa has become like a diplomatic capital, you know. We have places where we have identified, or cities that have been identified to be like diplomatic capitals, where everybody wants to go to, and everyone who aspires to be better would want to go to. And I think one of those such cities is Johannesburg. And obviously the Lagos that I gave initially. And also another one would be like Addis Ababa. Everybody wants to go there, and they think their lives are going to be better if they are still living in such a city. But then when you start to look at when people have moved to this place, there's a lot of construction cranes, and then you will see that, yes, there is economic growth annually, but what has happened now to the air? What has happened to the waters? Yes, we have industrial parks that have developed, but we have employed thousands of people, but what has happened to our air? What are our children breathing? Can we look at how our children are probably going to be suffering from high rates of asthma or any other respiratory infections? You know, it's like we have moved, we have grown, but to what impact? We still now need to say, okay, we have grown, now we need to invest in cleaner air. We need sustainable development pathways, which are not going to be centralized. We cannot work in silos. This has to be a collective. So I need each one of you to be thinking about this. All right. So now I just want us to bring us back to the development of or the evolution of this sustainable development, and where we come in and how we come in. Because like I was talking about the cultural pillar, there is something that we used to do from the colonial era down to the development models. There were things that we used to do. We need to bring them back. Let's bring them back and start to recognize the indigenous information that we have to be able to do sustainable development and to have sustainable environments. Let's bring that back. The information that we knew from our forefathers, that was brought from our forefathers to ourselves, let's bring that back. Let's recognize what particular communities do in trying to sustain themselves. Can we not just bring in, I know in Zimbabwe, you just wake up one day and you are told this land, you are told that this land has been sold because there is gold or there is diamond, and this land has now been sold to somebody else and you need to move. Can we have those discussions with the community members? Do they want people to be moved? Do they want to mine that gold? Do they want to mine that diamond? And when that diamond is mined, do they even benefit from it? It's a question that I always ask. Are they benefiting from it, or is something that just happens and then somebody else outside South Africa, outside Zimbabwe, even outside the rest of Africa benefits from? Because the investments came from Europe, Australia, or from America. They're the investors, they're the ones that are going to benefit from the mining. And so I just want us to say, can we have people talk about these things with our people before anything comes in? So I want to take you back again. Like in Africa, we have a saying that says, we are, or I am because we are. And this comes from the philosophy which captures, we are dealing with things that we're dealing with, but we are not looking at the interconnectedness of the challenges that we have. So the interconnectedness of the challenges that we have, it requires interconnected solutions. So the solution comes from I am because we are. And before the world had all these environmental issues, Africa had, I can promise you, there was something that was probably happening then. We had solutions. We had traditional ecological knowledge. And where is that? We had traditional medicine. Where is that? We had community-based resource management. Where is that? We had local food systems, not just cultural heritage, but we had practical solutions that could actually benefit us today. I want us to reflect and go back to those solutions. Because when you look at where we are at now, you consider like we are in a vicious cycle. And this vicious cycle, it's a vicious cycle of poverty. Poverty leads to biomass burning for cooking, right? Which creates air pollution and respiratory diseases. Are you with me? And then the climate change amplifies these changes, causing the droughts that lead to crop burning, further worsening our air pollution. Then we have urbanization, which increases the transport emissions, and then driving further the climate change problem. You see what I'm saying? And then we've got the environmental degradation effects, which have health outcomes that we witness every day. So now, I don't know, where do we start? Do we reduce the economic productivity? Or do we continue in our poverty? Or do we develop and break the cycle? Like, what do we do? Where do we go? It's like this is a vicious cycle that we have to deal with to feed ourselves and to grow and to develop as nations and as individuals. And culture is not peripheral. There is indigenous knowledge, there is traditional medicine, there is community stewardship, which offer rich, sustainable models for living. And every single time you think about these cultural systems, you must recognize that as an individual, there is something that you must do. There is something that you must integrate into your lifestyle to be able to control or to improve on the environmental, on our environment. I want to bring us back also to how we can now come up with our solutions but looking at it from an African context, I think I've given you a nice background of how this is very difficult, but I'm going to try to give you also an idea of how this can be possible and what we can do bit by bit, slowly but surely. I hope you are still with me there. So I know it's very difficult. Solutions seem like there is nothing, because the one big problem, we don't have money. What must we do? I'll give you a nice example of what happens in the Maasai region in Arusha, Tanzania. This is a nice example of how we must do things slow and easy, and use our traditional knowledge, which was there and seems like it is now under pressure. But this is what we used to do. So in the shadow of Mount Kilimanjaro, the Maasai communities have managed grazing lands sustainably for centuries. I think for those that know the Maasai people, this is what they do for a living. Their traditional rotational grazing system, called Olopoli, prevents overgrazing and it maintains soil health. And some of my colleagues there, they did some case studies where they reported that people, they explain that whether there is, they can actually predict the weather patterns by observing the birds' behavior. How amazing is that? So they look at the way the birds behave and the flowering of the plants to detect the weather pattern. You see, we are brilliant actually as Africans. You look at the birds, you know how the weather is going to be like. But now we have a problem. Climate change has disrupted all these Asian patterns, because some of the birds, we don't have them anymore. They have died because of the change in weather. So now we have no birds to observe to be able to predict the pattern. Some of the flowers have disappeared. They do not grow anymore because of the droughts. Now we don't know, because the flowers are not there. How can we predict what is coming? So this kind of, it now makes us vulnerable, because now we cannot even predict what's coming. We don't know if there's going to be a lot of rain, floods, because our traditional way has disappeared. And also the young people that are growing now, because of all these other problems, they're running away from these Maasai villages, and they're going to the cities. They can't stay there. So this knowledge is slowly being lost, because nobody knows it. No one understands it. Some of the things are not there anymore. The young people are not being taught, and we are losing the traditional knowledge. But we still need to adapt to the new climate realities. So what must we do? The first presentation was talking about now use of AI to be able to detect these. We use GPS technology to manage the grazing lands. Do we have the money? Can we afford it? It's a question I'm posing to you there. Of course, someone will say we've got AI to do these things, but can we afford it? Do we have the infrastructure to be able to observe this thing? That's one of the examples. I'll give you another one. You know, Africa is unique, you know, in all the way we implement things, the way we do things. We do things differently, because we have always had to adopt, and we are resilient. We have had to learn to adopt to what we have. And when you try to visualize, you know, what the SDGs are talking about, I'll give you a breakdown in a bit. You will see that the SDGs, they have there's 17 of them, but there is 169 targets, and there is 248 indicators that you have to comply with to say, now I have attained these goals. But for Africa, sub-Saharan Africa, we have had to adjust depending on what we have, depending on the resources that we have. So our way is not going to be everybody's way. Our way is going to be a different way. So when you look at it, if you look at the SDGs, you see that, of course, the first 5, they're talking about poverty, hunger, health, education, gender equity, addressing fundamental needs in Africa. All these, they are our African problems. But are we going to be able to address them in the way that the developed world does it? I tell you now, the answer is simple. No, we can't. Then we go to the next set of SDGs, prosperity. It emphasizes on energy, work, innovation, inequality, smart cities, and driving economic growth and urban development. Can we do this? The answer still is no. We can try, we can do everything that we can, but we are still very behind, decades behind in terms of infrastructure, and we are also decades behind in terms of the resources that we have. So, wow, I don't know how we're going to be able to do that unless if money is there's some other way of doing things. But otherwise, I don't see how we're going to be able to achieve this. Then we look at the planet. The next set of SDGs is looking at the planet, prioritize clean water, climate, life below water, and life on land, ensuring environmental sustainability. This one, if only we didn't have a lot of development, we could achieve. But now, because of all these other extrinsic factors, they won't allow us to actually be able to achieve this. But you see that without any money, without any injection of funds from some sort, we should be able to achieve these SDGs 12 to 15, because we are capable. We were capable before, and then now, because of other extrinsic factors, we are not able to do it. And then, of course, we've got the peace and partnerships, the last 16 and 17 SDGs. This we can do because we are a very peaceful society and we love working together. Like I gave you the example of I am because you are. So I know that as Africans, we can actually be able to promote and work collaboratively. And that's why I'm saying our solutions are not going to be able to come in silos, but in working together. So now, how do I present this now? Because we've got, obviously, there is climate change, and then we've got this health nexus in Sub-Sahara. How are we going to address it? I'm trying. This is me trying now to come up with solutions for the problems that I have highlighted to you earlier on. And then I'll just tell you again, and then try to give you some of the ideas that I'm thinking about. So I gave you this problem that we've got malaria as an endemic across most African countries and now because of climate change, it's worsening. And a good example I gave you is the Ghana one and in Nigeria. But really, even in South Africa, in Zimbabwe, we are all still suffering from this. And what are we doing about it? What can be done? The next thing is the solution is you use a pesticide to control the malaria, and that pesticide again is a problem. I leave it there. I don't even want to go into that one. And then when you talk about the air pollution risks, it is the major one. But now, do we refuse development? Do we refuse continuous growth? Do we refuse economic growth? I don't know. Please, can we talk about this? I'll give you an example of Bamako in Mali. This is just an example I want to give you before I go to talk about food security challenges. This one, I should have given it to you when I was talking about traditional medicine. In Bamako, there are healers, they call them, I hope if there are people from Mali here, you tell me. There are healers that they call the Imnata Traore. They have practiced for generations, and everything that they use traditional medicine to treat diseases from malaria, cholera, even diabetes. And there's been a lot of research that has been done there. And for sure, these treatments have shown that they really do have the anti-malarial properties. and then also some have the diabetes fighting components, you know. And there's a traditional medicine that has been used to treat such complex problems. But now, with the urbanization and the climate change, you can see that the diversity of these plants may be threatened, and we may lose these things. And even when we talk about the expansion of cities, we may also destroy some of these traditional gardens. And then while we are changing the patterns of this plant growth, you will see that, no, man, what's going to happen now when we don't have these anymore? Yeah, because you will see that this is a critical problem, and you need to make sure that all these plants, you cannot really say, I'm conserving this part only and you can destroy this part. No, we need to conserve all the areas. And now, can we still do that when we are talking of city expansion and urban growth? We can't do that. So it's like we have a problem, and then we don't have a solution. But then I want us to just talk about the SDG roadmap. Like, how do we now manage it? Because we need to make sure that these climate change problems, although they're detrimental to a lot of our detrimental to us, our health, we need to make sure that we control it. How do we do it? I want us to also just move on. I don't want to dwell on this slide. I want to move on, because we need to get to the point where we're saying, how are we doing this? How are we controlling the pollution or the exposure, the floods, and all these impacts from climate change? So I will take you back to something else. This is just for you to think about. I've given you like a roadmap of the SDGs, where it's talking about each set is focusing on something. But we need, us here in sub-Saharan Africa, we need to adopt to local solutions that are possible for us. And African countries, we must not look at the global solutions, or even, because I know that when you look at the global solutions, we know we can't do it. So now, what are the local solutions? We need to have to include ourselves, like have an inclusive region-specific approach. In South Africa, in Africa, how are we going to be able to manage these problems? Can we manage it? How are we going to do it? Where are we going to get safe drinking water? How are we going to control urban expansion or urbanization? How are we going to be able to control the movement of people? Or how are we going to be able to take people back to what we used to do? Because this is where our problem is. We need to go back to what we used to do. Because now, just to bring you back again, another context, a climate change, you know, I know when you say climate change, every time you think of it like as a jargon that you can just throw and say, climate change, climate change. But it isn't just about environmental issues, because all these impacts that climate change is bringing, they have an impact on our health. Now we have public health crisis. These rising temperatures, they are bringing about heat-related illnesses. Have you thought about that? These changing rainfall patterns, they are creating perfect conditions for vector-borne diseases, like the example I gave initially of malaria. Have you thought about that? And these health impacts cascade through the entire communities. And then when we look at that, and this is not rich communities, by the way, because we are developing countries, this is in poverty-stricken communities. Now you have other burden of all these things. So the impact of climate change on health is actually undeniable. And you know that when we've got polluted water, we've got the waterborne diseases. And then this is now bringing in another aspect of food insecurity. And then we've got a new dimension of health problems, respiratory ailments. And then we know that in our communities, the children and the elderly are the most vulnerable. Do we even have funds? Because I know in some places there is funds to protect them. Do we have funds to protect them? So I don't want us to think of climate change as a jargon. I want us to think of it as a health problem. It is imperative for us to do that now. I hope I'm still with you. And please stay with me, because I want us to understand and be together. When you look at it now, I just said, when I was tasked to give this discussion, I just looked at in sub-Sahara Africa, what research have we done on climate change? I may have used interesting words just to talk about climate change in sub-Sahara or in countries in sub-Sahara, but look what I found. 153 studies have been done, and they've been published between 2001 and 2024. Colleagues, is that enough? Academics on the platform from Africa, is that enough? Sub-Sahara, I don't think so. And then only 24 out of some of the 53 countries that were published, it's studies on climate change and health. Still, I don't think it's enough. And of all these, South Africa and Kenya are leading on the 24 studies. And the 22 studies are respectively on climate change and health. I really think we need to do more. And I will need to collaborate with the people on the platform to be able to do this, do maybe a comparison of what you've been doing, what you're experiencing, and what we're experiencing it here, and then how you have combated it and how you have controlled it, so that we can see if we can also do it here, because I really think we are not doing enough. And then there is 15 countries in sub-Saharan Africa with fewer than 5 studies highlighting gaps in Central and West Africa. Clearly, colleagues, there is a huge gap of work that we can do. And the research that we can do, we can focus on extreme heat, drought, flooding, and the limited focus can be on air and chemical water quality. So I will ask Prof. Satpath to make sure that this is done and this is effective, and we have learned and we have moved from what we have. So now, I think we have seen now from what I presented earlier on, and now what has been done, I now want to present the interconnectedness of the challenges, so that we now start to think of how we are going to do what we need to do. So when you look at, I think I've given you the scenario already, how poverty is leading us to use the biomass burning, and then where we've got the climate change amplification, and then we've got where we need now to make sure that whatever we consider as a problem as a result of climate change, how we control it to make sure that does not continue. And we are here today. Some of the effects, we may not witness them per se, but our children and our grandchildren are going to experience this. What do we want to do to make sure that they're going to have a nice environment that we are experiencing now? So I want us to think like that. And these are some of the thinking systems that I just presented here. This presentation will be available, and Prof will share with you, so that at least you have a look back and see how we can work on that. Now, I want to just share with you some success stories and some solutions, like I said. I want to take you to Ouagadougou, Burkina Faso. So in Ouagadougou, it's a place where they once called the land of upright people. And the reason was that they were looking up. Now they face temperatures that regularly exceed 45 degrees. The city's rapid growth has created an urban heat island. downtown areas are even 8 degrees hotter than the surrounding rural areas. And you can see that this was as a result of the excessive construction. And now they say that in Ouagadougou, reports by Professor Odrago has reported that there's been an increase of 300,000 in heat-related illness during all the hot seasons. And some of the construction workers collapse from heat exhaustion, and children develop severe dehydration. And there is the elderly patients, they suffer from heat conditions and face life-threatening stress. And they report every single time that even there is few trees that can provide precious shade. Can you imagine? It means there's been a lot of cutting down of trees, a simple thing. But the urban development continues to remove them, and neighborhoods without electricity face impossible choices. So there is continued what? There's continued use of the biomass, and now they have a problem. So what is the solution that can be done there? I gave an example earlier on to say, now because they were cutting down trees, everything was being cut. You need to come up with those solutions to say, maybe now every Monday or every Sunday, everyone must plant a tree. You know, you come up with, you have trees that are there. You have seeds probably. There's trees that can grow in certain lands and certain fields. It's a simple solution I am proposing. Every day or every Monday, can you make it a responsibility to say, I'm planting a tree or I'm planting something, you know? And there's been some community-based social programs where if you do this as an initiative in your area, you make sure that everyone comes together. You plant the trees, and the trees or the area is named after you. I don't know if you are still with me. The trees are named after you. You take care of them. You still go back together and you check if your tree is still alive. And you know, it's simple solution. It's simple solution that you can take and you do. And then there's community health care programs. I gave you the example where I was saying before we had elderly mothers, older mothers, older wives teaching young wives, older mothers, aunts teaching young adults. There has been community healthcare workers that can be trained in communities. They don't need degrees. They don't need PhDs. These are people that are already in the villages that can actually benefit from doing this. They make sure that they use the simple resources that are there, even walking from door to door. You have time, even during Sunday sessions or Saturday sessions where people come together, you sit, you give each other advice on how to have, to plan your family. You just don't have kids randomly. You plan to have your children. Do we still have those grassroots level engagements in health and environmental initiatives? We need to go back to that. It's simple. I don't think anyone will say we need a multi-million-dollar grant to do this. No. Excuse me. So this is just some of the examples. I will give you another example because I'm seeing that my time and my throat are running dry. I need to finish up. So we also don't want to get people to force us to do things that we cannot do sustainably. We need to be thinking of solutions that we can sustain ourselves and that we can continue to do with or without funding. Like, for example, I want to take you through a pollution cycle that happens. During droughts, there's crop burning, there is biomass use, there is obviously people still move up and down. We all contribute towards a cycle of environmental degradation and poor health. So what we need to do now is to have a systems-based approach that is going to recognize that parts of a larger interconnected, that is going to observe that a larger interconnected web. The example I want to give you happened in Dakar, Senegal. This was presented to me by one of my colleagues. And they said to me, Martha, in Dakar, in the mornings, there is a morning rush that creates a perfect storm of environmental and health challenges. Thousands of car ripens, like there is like a colorful painted buses that are blowing, burning low quality fuel as they move around and spewing black smoke. You can't stop them because there is nothing that regulates their movement. The street vendors are cooking over charcoal fires, adding to the same air pollution. And during the Hatman season, dust from the Sahara mixes with the vehicle emissions. I'm trying to give you the picture here. Creating like a toxic haze that blankets over the city. And then when he was reporting to me, he said when they went to the Fan hospital, one of the pediatricians there said to him, they treat children with respiratory problems that spike during these pollution events. So which means had they not be having that kind of dark skies, or they may not be having such problems. But the system extends beyond the transportation. It's also the burning of wood and charcoal for cooking, which is contributing to the deforestation, and then it contributes to the dust that is now coming in, which is being blown by the wind. Are you still with me? So now you've got air pollution outside, you've got indoor pollution. Whoa, it's just a lot. Now, where do you start? How do you manage this? And then I went to my home country. I want to give you an example from Harare. Harare's water crisis illustrates how environmental, economic, and health challenges interconnect. The city's water treatment plants was built in the 1950s. And then it was saving a population of about nothing more than 300,000. But now it's saving more than 1.5 million. And the economic challenges have prevented infrastructure upgrades. They cannot upgrade it, leading to frequent water shortages. And then residents now in some of the townships, they have dug shallow wells around their areas. And that time there's also sewage around, because there's the infrastructure for water reclamation is also not functioning well. It's a mess. So now there's water shortage, and then there is issue of drinking contaminated water and spreading of diseases. And then the city wetlands, the natural filters are destroyed because of urban agriculture and also continued city extension. My God, I don't even know where do we start and where do we end. This is also an example from my homeland in South Africa, in Zimbabwe. By the way, I'm from Zimbabwe, but I work and live in South Africa. So now I'm just going to bring you back again to the business and SDGs in Africa, and then the actions that we can do on the pillars that I presented to you earlier on. So we need to make sure that we act to reduce harm, analyze the value chains for environmental and health impacts. We need to implement cleaner production, but this cleaner production can only be effective if we have regulation that does not exempt some companies. And it means if you are going to invest in a company in Africa, in as much as you are going to employ a lot of people, can you also invest in cleaner production? Make sure your air is cleaned before it is released back into the atmosphere. Reduce your sulfur dioxide, putting the sulfur dioxide, which is being induced into the atmosphere, reduce that. Reduce the sulfur that is going to the water streams, the nutrients that is going to the sulfides, and reduce all these things. Invest in treatment plants within the factory. Invest in a cleaner plant which reduces what you are releasing into the atmosphere. I hope you're with me. A bit of emotional talk there. And then the environmental impact analysis and assessments, can it be done to make sure that these solutions are something that companies really dedicate and have that social responsibility to want to do it? So if you're going to employ a lot of people, can you also invest in trying to reduce the pollution you are going to do? So some of the success stories, I think they will come in from a point of people being committed, people wanting to do this instead of being forced to do it, but people knowing that it is them that should be doing it and not to wait for someone else to come and do what they're expected to do. Okay, I think this I've spoken about this in the earlier slides. I want us to go to actually the solutions slide so that I can conclude my talk. You have these slides so that at least you have an understanding of some of my thought through process that I went through to get to my solutions. So in trying to achieve the integration of SDG in Africa, this is what I'm proposing. First of all, we need to be shying away from working in silos. Can we work together, promote multi-sectoral collaboration and partnership to address all the issues? Can we go back to our Ubuntu, I am because we are, and make sure that every solution comes from us as an individual? Can we have community-led solutions where each community is responsible for the areas where they are? Can we have evidence-based policy research that shows that this area, there were birds that we used to look at, they are gone. We need to bring them back. Or we need to bring back that culture that we used to have. How do we do it? We need to preserve the flora and fauna that we have now. We need to have people bringing in not only their academic caps, but bring in their responsibility caps to make sure that I do this because I need this to be feasible and to happen. But of course, all of this will require funding, a lot of funding. So where are we going to be able to find it? We need to start, because there's a research gap, we need to make sure that we start to look for funding, that we sit together and propose what needs to be done. And then we apply for those funding. I've seen several funding calls that are addressing climate change, but it is looking at multi-sectoral and multidisciplinary research. Can we be able to do this from this platform? Can we form groups that are going to be able to tackle these? I can share some calls that I've seen, and we work together on them, get funding, and get to do projects in the communities that is going to be impactful and reduce climate change problems and be able to alleviate and attain the SDG goals. And then I'm not going to talk about the technology innovation because we've got a lot that we already learned in the morning. And then just to emphasize that you cannot do this on your own. You need to make sure that everything that you do, you're doing it with somebody that has resources, somebody that has experience, and somebody that is going to be able to make sure that information is disseminated worldwide and reported accordingly, so that you just don't do research that stays in articles that are not read. Can we be able to interpret our research and our findings in a way that people will be able to understand and then they know that they can adopt the solutions that would have given in our findings and in our projects. And then, of course, we report on the progress, because we don't want to do research for the sake of doing research, but we want to do research that is impactful and that has results and that is sustainable, because that way we are able to attain the SDG goals. And over and on top of that, we are able to actually improve the people's livelihoods and well-being and the general public health. I hope I'm still making sense, although I think I've been talking too much. So now I want us to look at the future opportunities and what we should be doing still. This is us too now trying to come up with solutions to the problems. You know, the young people of today are the ones that I am also challenging. The young people, I challenge them because they are going to be there, even when we are not there. We are here now, and we are still trying to talk about attaining SDGs. What are the other people going to be doing? What are the innovation and entrepreneurial potential is there? What else should be done? People can then look at coming up with like solar. You know, I'm excited when I see people putting in like solar panels to make sure that they have solar powered electricity. You know, it shows that, okay, there is a thought to this, and in as much as it may be cheaper, it is also environmentally sustainable. And this is the kind of thinking that I want our young people and our people that come up with ideas to start to think about. And also just to say, when we talk about natural resources, and we have a lot of opportunities here in Africa, we've got lots of resources, natural resources, we have a lot. What is it that we are doing that is making sure that we are harnessing the potential that we have in as a continent? And then this is what I'm going to say. And please, I know it may be too much, but this is my final and last word to say: call for action. What am I saying? Remember, I can be a starting point. And by saying that, I mean you also can be a starting point. Each of us has a role in terms of policy making, in terms of research, in terms of community leadership and innovation. And as a sustainable future for Africa, if we do this, it is actually possible, but only if we act together now and with intention. I too can be a starting point, should be the mantra after this presentation and after this webinar. This is just a slogan. I'm thinking it will make you think about this every single time as an individual, as a community, or as a leader of an organization, so that you're able to play a role in creating sustainable, healthy, and prosperous future for the sub-Saharan Africa. Because the challenges that we have, I'm sorry to say, they're real and they're interconnected. And so the solutions are actually within each one of us, and they require collective action. And the time to act is now. And as we look forward to the future, I see the young population driving the innovation, us driving the vast renewable energy potential, because that's what we've been working on already, and a growing environmental consciousness. This is what we need to be doing. I see digital natives using technology to solve old age problems. This is what or where we should be going, considering the presentation earlier. I see communities coming together in spirit of Ubuntu, so that the future of Sub-Sahara and indeed the world as it is right now, it is dependent on our ability to stand or to understand that we are all interconnected. And the health of our environment is the health of our people. And this prosperity of our communities is the prosperity of our planet. And if our planet is good, then our health is good, and then our people are happy. And then the strength of the partnerships that we can form with these webinars or these talks that we do is the strength of our progress. Because we don't want to do this in vain. We want to have solutions after this presentation. What next? So the journey towards the sustainable development is sustainable, or is actually real and can be sustainable. And in sub-Saharan Africa, it isn't just about achieving the SDGs, but it's about reimagining what development means. It's about honoring the wisdom of the past while embracing the innovations of the future. And it's about recognizing that our interconnected world, there is no challenge which is bigger if we work together. I thank you.
What a wonderful talk, Uh, like you have captivated the entire audience, Dr. Martha. Like it's been wonderful.
Thank you so
Yes,
much.
yes, yes. I just wanted
Thank
you
you.
to, yeah, I just wanted you to continue and speak because you're full with so much passion, and the team sitting back in the background, they were telling me, sir, she has got the flow today, and she's not going to leave. I'm like, yes, she deserves it. She has all the rights to speak. And you can clearly see there is no electricity at my place. I'm putting a mobile phone light just to speak to you. And I could not miss
Thank
this
you so
moment.
much.
Yeah, I could not
Thank
miss
you.
this moment.
I really enjoyed the talk because I brought it to myself. And you can also see we don't have much electricity. I'm using solar as well.
Yes, yes. So we'll have a brief panel discussion now. There are about 25 questions, Dr. Martha. What I'll do is I'll send them by email to you, and so please respond
Yes.
to them. Yes. So just for the sake of time, because the participants have been here for almost 4.5 hours now, and you can
Yes.
clearly see still 290 people are available on call right now at 10:30 p.m. Indian time. So it's quite late. They have been still here, and it's really amazing with the genuine, authentic engagement with which our participants come from all over the world. So that inspires me to make and strive better so that we can get more panelists from all over the world. And each weekend we are
Yes.
doing that. We have had stalwarts coming from literally all over the world. And you have also made immense contributions to that in this regard. So I'll go ahead with asking few questions first because these are very important. So in terms of framing the context and urgency, how are environmental degradation and climate change collectively shaping the trajectory of public health in sub-Saharan Africa, particularly in rural and low resource settings?
What was the first part? I didn't get the first part well.
Okay, how are the environmental degradation and climate change collectively shaping the trajectory of public health in sub-Saharan Africa, particularly in rural and low resource settings?
Okay. So what I can say, this is my personal opinion, and when I'm answering this is based on my personal experiences. I'll say, in sub-Saharan Africa, or in South Africa, or Zimbabwe, or Ghana, Kenya, Rwanda, all the places that I've been to, you can see that all the aspects that affect or that are as a result of climate change, they do not segregate. There is not going to be control to say these ones are affected more than these ones, because when a flood comes, it can affect from children, young adults, elderly, everyone is affected. So when we talk about these problems and where they are going, I want to say that they do not control, they do not segregate. So when this continues, it means we need to make sure that we control everything because no one is paid. That's my response from my experience. Yeah.
Definitely. Very candid response, in fact. We'll go to the second theme, environmental justice and vulnerability. How do structural inequalities such as gender, geography, and governance influence exposure and resilience to environmental and climate-related health risks?
Oh, okay. This is an interesting one. So, if you look at the unconfirmed reports on one of the websites, which I can share with you, it says South Africa has managed to actually attain the SDG goal on a 5 on gender. So I'll just talk about how we were able to attain this, and then how maybe it has impacted on us in terms of the climate change. Number one, we have attained this goal because the country has been very intentional about what they want to do in terms of protecting the other gender. And they've put policies which are being implemented to be able to control gender. There is a month of observing women, for example. There's a whole month of observing gender violence. And in those months, people are talking about what shouldn't be done when we're talking about gender, or what should be done when we are talking about gender equality. So when you look at this, all these aspects that you have mentioned here, it means for you to be able to get to the point of climate change resilience, you need to be very intentional about what you are doing and what you intend to do. And that way you'll be able to achieve your goal. I think that would be my answer for that question.
Okay. Right. Okay. So I go to the next question, which is basically about current environmental policies. So do you think the current environmental policies in sub-Saharan Africa adequately addressing the disproportionate health burdens faced by the indigenous, nomadic, and pastoralist communities?
Okay, that's an interesting one. I think I also gave an example where I said when we have environmental impact assessments in South Africa, there is a regulation a law that is managed by the National Environmental Impact Assessment, which comes in, and what they say is when you do an assessment of a company, you like the environmental impact assessment, and you see that this company is actually clearly having environmental degradation. They are clearly polluting. But if you look at the benefits of having that company in terms of employment, creativity, and poverty alleviation, then you say, no, this company can actually be exempted from these other environmental issues that they're supposed to comply with. I don't know if you get me. So now the question, if they can do this to big companies like in South Africa, we've got the one that provides electricity, Eskom. If they can do that to Eskom, which is a big company that is providing electricity for the rest of the country, and they exempt Eskom from complying with this environmental legislation. Now, can you imagine for the minority? I don't think it's enough. That would be my answer. Thank you.
Okay, right. So can you hear me and see me all right? If you can, please could you confirm that?
I can hear you and see you, but suddenly you went, oh no.
Okay, apologies. I was disconnected for a few seconds due to some issues here. It's quite bit difficult. Okay, the next question is, how can the public health systems in sub-Saharan Africa be reoriented to respond to emerging climate-sensitive threats like heat waves, drought-induced famines, and air pollution?
So my solution as an academic, my solution is in research. Everything is underlined in research. we need to go do research that is going to inform us on what we are going to do in terms of all these extreme heat waves or whatever their problems is. We need to have sufficient research done, and then we have evidence-based solutions backed by proper research that has been done. And as we speak now, I don't think enough has been done. That would be my response.
Yes, definitely. So the next question is, what innovations in climate-informed disease surveillance are emerging to predict and manage vector-borne and zoonotic diseases in the region?
That's breaking. I can't hear you, Prof.
Okay, there is some sort of.
I think maybe I would do best if I can actually get the questions and then I can answer. And then when you share the slides, you can also share with my my answers to all the questions from the participants. And then I think, oh, I see that even we still have participants. Okay. I was saying, Prof, that we could get, if we were struggling with network, we could get all the questions, we put them together. And then when you share my slides, you can also share my responses to all the questions, because it's like the network now is saying enough is enough.
So the question was, can current environmental policies in sub-Saharan Africa adequately address the disproportionate health burdens faced by indigenous, nomadic, and pastoralist communities?
My answer to that was no. The policies that we have now and the legislation that we have now is not sufficient. More needs to be done, and more needs to be regulated to be able to have a sufficient in that regard. Yeah.
So the next question is, how can regional and national governments operationalize climate justice and health equity through local SDG implementation plans?
So for me, I think they need to take it to the ground. The local communities should take ownership of all these projects that needs to be done. So the government must support the local communities to be able to do this, and then the solution can come from there. It has to be organic, and it has to be something that they want to do. That's my thought. Thank you.
Thank you, ma'am. So next theme is climate sensitive disease burden and public health preparedness. So the question is, what innovations in climate informed disease surveillance are emerging to predict and manage vector-borne and zoonotic disease in the region?
That one was supposed to be for Prof who finished, who did earlier. But from my perspective, I think there can be innovation, but it may not be enough, because look at us, COVID caught us off guard. So there is a lot of innovation where you can actually try to control, be proactive in controlling or taking samples, or managing what and trying to predict what is likely to happen, but maybe using the machine learning methods to predict what is likely to happen, considering the disease burden that we have experienced so far. But maybe Prof should have responded to this one. But my thought is maybe use the big data to predict what is likely to happen based on what we have been experiencing so far. I hope that will be useful. Yeah. Thank you.
So the next question is, how can public health systems in sub-Saharan Africa be reoriented to respond to emerging climate sensitive threats like heat waves, drought-induced famines, and air pollution?
I think there is a need to emphasize first of all, I believe in injection of not necessarily just unnecessary funds, but injection of funds that will sustain projects that will be able to give evidence to what you've just asked. So my first thing would be academics need to get funding to do research and have information on what needs to be done, but it will be evidence-based. And without that, I don't think anything can happen. So it starts with a grassroots evaluations, surveys at grassroots to really put into context what is happening there on the ground, and then start to ask at grassroots as well the solutions, because people have solutions to their problems. We just need to go there and extract them, and then now maybe restructure them into a way that is feasible and sustainable for the rest of our lives, and even for the lives when we are not there. I hope that makes sense.
Yeah. Okay. I'll go. I'll go quickly to the fifth theme, that is on water sanitation and hygiene. What cross-sectoral models exist or can exist to integrate the climate-smart WAS infrastructure into public health policy? Climate-smart WAS, water sanitation hygiene infrastructure into public health policy.
So there's been a lot of projects that I have witnessed, and I hope it will be something that would be helpful. The water treatment plants at this point in time, or the water reclamation and the water and sanitation in the urban area and in the rural area is totally different. And when you look at a sub-Saharan African context, in an urban setup, we've got a reclamation a system that deals with the grey water. And then we have the water treatment plants that brings in the water in the households. But this is what we have been saying, that the infrastructure that is there was meant to handle smaller populations. And over the time, they have not been developed to handle bigger populations. And that's where we need to invest in building a bigger infrastructure that will be able to uphold the populations that are moving to the urban areas. And then in the rural areas, we need to train people on how to clear or how do you call it, use safe water, like from boreholes or wells, and then clean it using like small bottles and chlorine at a small scale, not necessarily at a big scale. So there's different different folks with different solutions. So it's not going to be a uniform solution. What will happen in the rural and what happens in urban is totally different, but we need to be able to know what applies to urban, peri-urban, and urban area. Yeah, thank you.
Okay, the next set of questions are on financing innovation and climate health partnerships. And the first question I'll ask is, what innovative financing models can be scaled up to support climate resilient health infrastructure and green health systems in sub-Saharan Africa?
I think the health economics should be able to come and help me here. But from my experiences, I would what I would suggest and recommend, based on my experience, would be we need to start to do things that are not going to rely on any financial injection from anywhere, but to start to be able to do things that we can afford and that are going to be sustainable and that we understand. Because the moment we think that we need money to do anything, we are not going to do anything. So the financial models, economists must come up with those ones. For me, I want practical, hands-on, and cultural, traditional solutions that are firm and that apply to what we do. We don't need models. We need practical and feasible solutions. And those should be coming from us and the communities who are always affected. And then from there, we come up with solutions that are sustainable. Yeah, thank you.
Okay. The next question, you're based at a health sciences university, very focused on health sciences. So how can
Yes.
the climate health innovation ecosystems featuring the startups, universities, and civil society drive SDG aligned progress on health and environment?
Oh, that is a very good one. So this is what we are doing actually. As I'm speaking to you right now, and we've got 323 participants. This is us doing the SDG awareness, and we are giving back to the society what we know and what we can do. I am an academic. That's all I know. And in my academics, I do research that speaks to community engagement. And then in doing those projects in community engagement, I make sure that the projects are trying to combat the SDGs. So this is what we can do. We make sure that we do the awareness, people know, and then we tell them how it's supposed to be done. Like the solutions I try to give to say, we must not remove it from ourselves. We must take it back to ourselves and become the ones that are responsible. And once we do that, we drive the sustainable drive, and we are actually the agents of this drive that we are trying to look at in terms of attaining the SDG goals. I hope that makes sense.
Yes, it did, certainly.
Yeah.
So the next set of questions are related to community strength. So the question is, how are, in your experience or in your observation, how are the youth and community-based organizations shaping the climate health action at the grassroots level, and how can their work be scaled up and supported better?
So I, in my community engagement projects, I work with young people, and I work with young people that are in communities around Karankua, where my university is at. But over and above that, I work with young adults and those that are, I call them the missing middle. They are not so old, they are not so young. So you need to make sure that the people on the ground are the ones that come to you and tell you what they are struggling with, and then you advise them accordingly. Like, for instance, when I work with communities, the young adults are telling me that no one guides them or gives them a perspective of how to choose a career. So this is just an example I'm giving. It has nothing to do with SDGs, but they will tell me this is what they struggle with. No one tells them how to choose a career, and only for them to realize that a career is something that they have to do for the rest of their life, which means it affects their lifestyle, it affects who they are and who they will become. But no one talks to them about it. So they just find themselves into situations. So I take that into context and say, whatever I do, and when I try to give solutions, the problem has to come from the person I'm giving a solution to. I have tried to not to be like all academics who just come with recommendations where there's no problem. So I listen to the problem first, and then I give a solution for the problem presented in all aspects of community engagement projects. So that's how I work. Yeah.
Although I have a lot more questions for you, Martha, I would be emailing them to you. But for now, I'll be asking two more questions to you. What are the key data gaps in measuring the climate environment health nexus? And how can open data and digital platforms help bridge them?
Okay. So from my experience, and I think I've given you this as an example earlier on. We've got a lot of data that is collected by environmental health scientists. They collect when it rains, they know how much water has been received. They know the flow rate of the rivers around town, but it's like information that is collected and not used for anything. So in my understanding, I would think that to bridge the gap, we need to look at the data that has been collected and see, we are saying this river is contaminated. How is this affecting the nutrition value of the vegetables or fruits that are being watered by this water? And then what are the health impacts? So for me, the gap is there is no correlation between the science that is done or data that is collected, and then the information that we have, and then the impact thereof. So it's like the scientists collect data and say this water is polluted. And then I come in and say, yes, this river is polluted, but so what? So the gap is on the so what and what needs to be done. And that's where I'm saying, if we come together with the different experiences and knowledge, we'll be able to say, okay, from my side, I'll tell you the health impacts of eating food that has too much fluoride, for example. You will have this. Where a scientist will come and say, this water has too much fluoride from underground, it has been polluted, full stop. And then I come and say, if you take this, or you eat food, or you water your plants with this water, this will be the problem. Yeah. So that's what the gap is. I don't know if I am still within or I've gone wild.
No, you did answer that very well. Okay, the last question to you is a little bit futuristic thinking. So what does a resilient, climate smart, and health secure? What does a resilient, climate smart, and health secure sub-Saharan Africa look like in 2030? And what bold reforms are needed today to realize that vision?
Oh, wow. Yeah, this is really futuristic. I can't see that picture actually because you're looking at the resilient climate change and then how it's going to look like. I don't think we are going to be able to attain, like I said initially, from the background of what our African problems are like and what we are expected to achieve in terms of SDGs and in terms of what we are expected to know. I don't think we are going to be able to have, even in 2050, because now you're talking of 2030. There is no picture actually. In 2030, there's no picture. Even in 2050, the picture is going to be blurred still. I don't know in 3000 probably, but what needs to be done is what I've recommended already. Let's take personal responsibility. Let's work as a collective to be able to achieve, maybe if anything, let's achieve these 17 goals that have been set, but we are not going to achieve them as individual countries, but we are going to achieve them if we work together. Because when pollution comes, it doesn't say I'm an Indian pollution. It doesn't say I'm African pollution. It will affect all of us. So let's work as a collective and let's make sure that our answers are going to be answers for all. It's not answer for me. We work together for an answer for all. And my picture may be clearer then when we start working together to come up with the solutions. Thank you.
Wonderful. So with this, although the questions are not over and they are never going to be over, but it's been such a terrific, such a passionate and such a beautiful, very beautiful experience talking to you, Martha. You have become an instant friend and and I hope a long-standing partner, collaborator as we move along. I think all I see and all I notice is synergy. Look at it. You're based in South Africa, I'm based in India. We are building the Global South-led world's largest global consortium of global health. We have been here for almost close to 5 hours now. In 10 minutes, it will be 5 hours literally. And participants are here, 313 participants are still here. And we have been engaged with deep conversations, really deep conversations. And that shows the true authentic desire to make change happen, And so despite having no electricity for more than 1 hour, I have been literally sitting with my mobile flashlight and talking to you, and my young boy, yes, he is always there. So as the best steward to support me in every way. And so this global consortium is everyone's consortium, is people's consortium. When we dedicated it in January 2025, we said that this is not owned by any big university, big corporation, any multilateral agency. This is people's consortium. This belongs to all of you. because we are just trying to play a catalyst role, but at the end of the day, it belongs to everyone. It just doesn't belong to elites, the professionals or academics. It belongs to, or the bureaucrats, it belongs to people. And I think after today's lecture, I think I'm fully confirmed and affirmed with the fact, and with the hope that this vision is coming to a reality. So I'm very, very indebted and grateful to you for coming on the board, staying with us for close to 5 hours, and spending all this valuable time and illuminating us with all this wonderful wisdom and experience. But what is most important here, which should not go under notice, is the deep passion with which you fight for the issues that you truly stand for. And that shows up. I have been trained and taught by best of the academics in the world at Harvard, Oxford, Cambridge, University College London, UNSW in Sydney, IITs, and then University of Delhi and other top universities. But I think the passion that you carry is your true strength. I think as academics or any actors, we should be very, very passionate about what we are fighting for, what we stand for, because they resemble us, they reflect us as true entities. And I think, as you just said, what we are doing, or who we are, is the true strength. So we can make change happen. During one of your slides, you said that. I wish you could expand more on that. But honestly, after having heard you for more than 2 hours now, it's wonderful. I would love to engage more in conversations with you, and more work, more research. And so we shall be in touch with each other. The Global Consortium of Global Health, on the behalf of Global Consortium of Global Health, actors, leaders, and thinkers, Global Health Forum, Global Brain and Mental Health Forum, World AIDS Forum, and Global Psychiatric Association, as well as Bangladesh Institute of Innovative Health Research and other partners, would like to place on record our sincerest and deeply heartfelt gratitude and thankfulness to you. Thankfully, see, God is testing me every moment. The light had just come back when I'm closing.
I am the light.
So you can, yes. So you can see that God is testing us. Like, can you persevere? Can you persist despite all the adversities? That's what we truly need in this space. Because many times, all of us as academics become very conversant with the comfort, that comfort zone. We don't want to sacrifice. We don't want to compromise. And that is, in fact, one of those biggest tests that God takes, from us. That can you sacrifice that comfort to persist and persevere despite all the challenges, all the hurdles and bottlenecks. I think we have done it. Today's session is a testament to that. We have literally gone live on YouTube without any electricity. And the session has been recorded, streamed, people have watched it. Thousands of people have watched it already. Okay, so that shows that we have the strength, and we have what it takes to build the Global South-led, world's largest global consortium of global health, and to lead the future of global health. The future of global health belongs to Global South. This is something which I want to affirm in today's meeting once again. Okay, so that's all from my side. I'm very, very happy to have met you and talked to you, and I'm sure our paths will continue as our journeys continue, and we'll do many great things together for our countries, because our goals are same, our contexts are same, our pathos, our problems are the same, and I think we can do a lot of things for each other. We don't really need to be dependent too much on the West, which is too busy in their own affairs anyway. So
exactly.
So okay. So with this, our admin team would be in touch with you for securing your e-signature to be printed on the certificates of people, the participants. And in addition, they would be also in touch for the slides, because I think 200 plus people have requested for your slides, which I'm like really, really flabbergasted by their requests, and they are so passionate. You can look at, they're still sending emojis. 264 people still present on the call after 5 hours. So it's been wonderful. And after this, what I will do? Yes, what's the next step? You asked this during presentation. The next step is I'll be sending you the questions, the panelist questions. We have two plans. First is, and we are doing that for the entire global dialogue series. First is that we are planning a regional policy brief which will be submitted to all the governments of 54 nations in Africa. So we as the Global Consortium want to play a role, and we have all the stakeholders. You'll be very happy to know in the Global Consortium, as far as members are concerned, I think more than 1,000 people come from African continent itself. So we have a huge, very strong, presence of African members itself. So I think we are in a good position, and we have a legitimate position to actually send our policy briefs to the governments. First thing, so that will be co-authored with you. Second thing is that we are planning to come out with a few papers based on everything that we are talking about. Okay, so they will be also co-authored with you. Some of them will be like you will be the first author. Some there will be other people on board also, because we have a big plan. And then again, I also want to apprise you that we are planning a big global Africa symposium. It's not a symposium, it's going to be like a big conference on Africa only. So pure African continent. So where health ministry people from different ministries, as well as academics, not just based in Africa, but outside Africa, but interested and working on Africa, would be coming on board. So you are welcome and invited well in advance. So I'm just telling you, or live on record. So please accept our invitation the next time. We would love to have you, because this passion, I don't think not many people would have it. So that's your strength, and we are very, very grateful and very lucky to have that. Okay, so with this, my job is over. So I would request our admin team, Mr. Faisal, to do the last things. Thank you.
Okay, thank you.
So a heartfelt thank you to Professor Dr. Martha Chadia for that incredibly engaging and critical session on climate justice, environmental health, and public health equity in sub-Saharan Africa. Your valuable insights helped us understand how intersections of environment and health are central to achieving SDGs, and why community-led, equity-driven solutions are key to transforming systems in the global south. We are also grateful to Professor Maheshwar Satpathy for expertly moderating both sessions today with depth, empathy, and clarity, and with no electricity. So thank you all once again for being part of this inspiring evening. Let us carry today's learning forward in our work and our collective action for a fairer, healthier world. Thank you, everyone, and good night all.
Okay. Okay, thank you, everyone. The attendance link has been shared in the chat. Please have a look. The attendance link has been shared. So please have a look. Are you there?
Yes, sir.
Are you frozen for a minute? I don't know. I mean, you are still frozen for me. I don't know.